And it does sound concerning that that decision has been taken. I would urge all councils to work with their local ICBs and other parts of the NHS system to make sure that that healthcare is provided in local areas where people can access it as part of our plan to make sure that healthcare is available right across the country.
David Reid.
Question number 7, Mr. Speaker.
Mr. Speaker, too many men live too much of their lives in poor health and face barriers to accessing health services. That is why we have published England's first ever men's health strategy to get men speaking about their physical and mental health, and we're getting on with implementing it. From partnering with the Premier League to investing in the Men's Health Community Fund, we are meeting men where they are and supporting them to live longer, healthier lives.
David Reid.
Thank you, Mr. Speaker. The NHS itself says that prostate cancer often has no symptoms at first. Prostate Cancer UK says most men with early prostate cancer have no symptoms at all. Now, the government's own Transform trial exists because current detection methods are recognised as inadequate. So why does government messaging still point men towards early symptoms they are unlikely to have, while cancers that could be cured are becoming cancers that cannot?
Mr. Speaker, let me be really clear in my advice to any man who is worried about prostate cancer, whether he has symptoms or not. Go to your GP, discuss it with your GP. Testing is available when people's GP recommend it, and I would recommend no man to worry about it in silence, to sit at home and fret about what might be going on. Go to your GP and discuss it. With regards to the wider screening programme that we've agreed to do as a government, the targeted screening programme, that is based on the evidence of weighing up the benefits of screening versus the harm that it can cause. Because we know that at the moment, if you identify cancerous cells, Mr. Speaker, and have treatment, for example, by removal of the prostate, in 20% of cases that leads to permanent urinary incontinence and in 2/3 permanent erectile dysfunction.
Steve Darling.
Number 8, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. With permission, I'll take questions 8 and 20 together. We inherited a decades-old system where patient voice was divorced from decision makers, with over 20 organisations offering a place for patients and users to share feedback. The Health Bill will put the views of patients and users at the heart of decision-making, ensure it directly informs those responsible for commissioning locally, and we'll create a new Patient Experience Directorate in the department to ensure patient and user insight directly shapes national policy making.
Steve Darling.
Thank you, Mr. Speaker. The abolition of Healthwatch will see the NHS and the government effectively marking their own homework. Can the Minister please give some assurances how the government will ensure that the voice is heard from those with learning disabilities, complex needs and dementia?
He makes an important point about the variety of needs that local commissioners need to take account of, and that is exactly what the Health Bill will try to do, not by outsourcing that role to an outside body, but putting those views at the heart of what all commissioners to do, which includes making sure underrepresented or normally often unheard voices do have that exact voice.
Thank you very much, Mr. Speaker. When Boots decided to close 2 pharmacies in Hampton, leaving a large number of elderly and vulnerable residents without local pharmacy provision, Healthwatch Richmond played a crucial role in ensuring we got a new community pharmacy in that area. That locally led patient voice can't be replaced by officials in Whitehall or our local ICB that's about to suffer over 50% cuts in its operating budget. So will she think again if she's really serious about championing patients?
Again, she raises an interesting example of somewhere where the local commissioners have failed to provide a service or recognise when a service disappears. They can do that through using very different voices rather than outsourcing that responsibility. We have to make sure, as we go forward in this bill, that commissioners do their job properly, which includes patient voice at that very local level.
Jill Muskell.
Replacing Healthwatch will mean that ultimately patients will not have confidence in the commissioners. We've just heard one example, and I can offer many examples in York where York Healthwatch, which is phenomenal, led by Sean Balsam, has led reports which has brought about change. So I do plead with the government to review clauses 64 and 65 of the Health Bill to maintain Healthwatch. It should not be either or. It needs to be commissioners engaging with the patient voice, but also Healthwatch having that independence to advocate advocate for patients.
I thank her for her comments and her comments about her local health watch. And there are certainly examples where this does work well in local communities, and we need to understand those. But it doesn't work well everywhere, and it does mean that local commissioners are not then empowered and indeed held accountable for their job of making sure that that voice and experience is held locally. There is also nothing to stop ICBs undertaking that role differently as they see fit in their local communities in the future, rather than dictating how they should do it through one particular body.
The Brash.
While I support the government's desire to drive out bureaucracy from the NHS and simplify systems for patients, locally, Healthwatch Hartlepool has done an outstanding job in ensuring that patients' voices are heard as systems and services are improved. So what can the Minister do to ensure that that local expertise is retained in any new system?
And I thank him for his comments. And again, it's highlighted that if that works well for his local system, there is nothing to stop, and indeed the ICB's role, how they undertake that role, has to be determined locally to make it most effective for those local circumstances. And they can undertake that role as they best see fit.
Graham Stewart.
Thank you, Mr. Speaker. People in Beverley and Holderness... Oh, number 11. Sorry, Mr. Speaker.
Thank you, Mr. Speaker. Over 85% of waiting list removals are as a result of patient care. And since the end of the pandemic, unreported removals have been below pre-pandemic levels. Record levels of elect activity are being delivered by NHS staff, enabling us to cut waiting lists and meet our interim target of 65% of patients being seen within 18 weeks, the highest performance in over 4 years.
Graham Stewart.
Speaker, and I apologise for being taken by surprise. People in Beverley and Holderness want high quality and speedy care, not massaged health waiting list numbers to suit Labour narratives. And of course, Mr. Speaker, you'll remember that the last Labour government had form on this as well, when repeatedly the NAA found that the numbers were manipulated when waiting lists were similarly put on a pedestal in that way. So can the Minister, and perhaps with the new Secretary of State by her side, how can she give reassurance to people in Beverley and Holderness that we are going to have genuinely improved health care rather than widespread manipulation and cleansing of waiting lists to suit political purposes?
Well, the last Labour government, if anyone's forgotten, left the NHS in the best state it had been with the government. And that is not in dispute. That is not in dispute in terms of waiting list targets or indeed of patient satisfaction. He might want to re-look at that record. This point that the Conservatives seem to be intent on following up forever is an important one. 85% of the activity is as a result of direct patient care. Validation, both clinical and clerical validation, is long-standing routine practice of waiting list management. It is no different now at roughly 15%, slightly higher before the pandemic, than it has been before. So it is just not the case that there is something different going on here. What we are doing is making sure that patients, his local constituents, and I appreciate in his system there are many other local problems going on at the moment, they can be clear that people on the list are the right people on the right list for the right care in the right place by the right clinician, and that is what we're determined to do.
Thank you, Mr. Speaker. I commend the Minister for her work in reducing waiting lists for GP referral to first treatment, and they are genuinely coming down. She will be aware, however, that that statistic doesn't capture the entire picture, particularly for people who then require subsequent follow-up care. For example, women with endometriosis or women waiting for breast reconstruction following breast mastectomies. Could you say a little bit about any plans she has to capture those waiting lists?
I thank him for his question, and of course he is someone who does understand the way in which waiting lists are managed and so on. We don't have any plans to add any particular new targets to those that we have already committed to give confidence to the British public that we can fix the NHS and get those waiting lists down. But he raises an important point about how we support patients understanding where they are in the system and where their care will be provided. That is part of our commitment in the elective reform plan that we outlined last year, that patients are kept up to date about where they're being treated, why they are being referred on to perhaps a more local service, and we will continue to try and do that.
Gentleman Stocks Luca.
Thank you, Mr. Speaker. And last month, the Health Service Journal reported that elective waiting list target was met largely largely because a record number of patients were removed from waiting lists in March without receiving treatment. So can the Minister tell the House how many patients were removed in March, what happened to them, and whether she is satisfied they definitely didn't need treatment?
Well, again, as I said earlier, I'm still a bit perplexed as to why the Conservatives are perpetually highlighting their inadequate management of the health service and the idea that patients are simply referred to a waiting list and then left there for a couple of years, which is what happened under their watch. It is important that patients know why they're on a waiting list and that obviously they get the best clinical care in as quickly as possible. I don't have to my hand the exact figure in March. That will obviously be published as part of the normal process when we publish the waiting list targets. I can tell him that completed pathways were 5.9% higher in the 21 months from July 24, when we took office, to March 2025 than the previous 21 months. Patients are getting the right care in the right place that they deserve under this government.
Lord Charles.
Question number 12, please, Mr. Speaker.
Mr. Speaker, it's not just the Conservatives raising this, it's patients and the Health Service Journal. And the answer is 350,000 people. That's a city the size of Coventry, wiped off the waiting list with no treatment. And it's 100,000 more than the month before. So if there's generally nothing to hide, the government shouldn't worry about pushing these figures out. So will the Minister commit to a review to find out what's happened to these 350,000 patients? Or does she believe that waiting lists should be met by removing patients from the figures rather than actually treating them?
This is an established way of managing waiting lists and waiting times. We are making sure that there is adequate clerical and clinical validation of the list and that patients are treated where they need to be, closer to home and often in more local circumstances. Of course, we have committed to greater transparency than was had under the previous government. We continue to do that. Obviously, if there is something that comes through that, I'm very happy to the exact question I didn't quite follow from the honourable gentleman. We are confident in the data that is coming forward. As I said, this is standard practice. It is roughly about 15%, as it has been over many, many years.
Lord Charles.
Thank you, Mr. Speaker. Number 12, please.
Minister.
Thank you, Mr. Speaker. Health visitors play a vital role in supporting babies, children and families. Under the previous government, the number of health visitors fell significantly, which is why this government has taken action. The upcoming professional strategy for nursing and midwifery will set out a bold direction of travel to strengthen health visiting across England, and we have already made improvements with all post-birth health and development reviews now completed for over 80% of children nationally, the highest levels since recording began.
Lord Charles.
Thank you, Mr. Speaker. I recently gave evidence to Baroness Amos's National Maternity Inquiry sharing the trauma my wife and I endured. And after the birth, even as she carried her own burden, she was my rock. But the NHS was not. I was invisible, no one asked about me, and I was left to carry it alone for months. So will the Minister please ensure that health visitors recognise dads and other non-birthing partners, check in on their mental health and help them access support so that no more dads are forgotten when families need them the most?
Thank you, Mr. Speaker. And can I thank my honourable friend for being so brave and willing to share his and his wife's birth trauma and about the lack of support afterwards, not just with Baroness Amos and her review, but with the House today. I know personally how hard it is to do that, but I also know the huge difference it can make to government policy. I am happy to commit to him today that the government will absolutely look closely at all of the findings in Baroness Amos's review and with the National Maternity Task Force to translate the recommendations into action. I am also pleased to confirm that we have recently updated our National Health Visiting Guidance to include a high-impact area on family mental health with a clear focus on supporting both mothers and fathers.
Speaker, it's not just the number of health visitors that needs improving. Women report to me they've skipped appointments due to negative experiences with health visitors, especially around breastfeeding. Will she commit to improving the training of health visitors so that women are receiving the best quality care?
Yes, I will. We are busy working on the 10-year workforce plan, and the training of all the NHS workforce, including health visitors, is a big part of that. I am in my new position as Public Health and Prevention Minister. I am particularly interested in the work of health visitors, and especially with regard to breastfeeding and supporting rates of breastfeeding. And he will be aware that the breastfeeding survey was released, the results of that was released last week, and they did show substantial improvement.
Question 13, please, Mr Speaker.
Minister.
Thank you. This government is rebuilding England's broken NHS dentistry system. The Dental Recruitment Incentive Scheme encourages dentists to work in underserved areas. Data on the scheme's effectiveness will be published later this year. We're taking steps to increase the supply of dentists. For example, last week I was very proud to announce the first sustained expansion of dental school places since 2007. Backed by £11 million per year, a total of 50 dental school places a year have been allocated.
Mr Smart.
Thank you, Mr Speaker. My constituent John, who's from Bredbury, has been in touch because, like so many others, his local dentist is going private. And for many families in my constituency, private dentistry simply isn't an affordable option. Research by the British Dental Association found that 96% of practices are not accepting new NHS patients, and a golden hello worth £20,000 over 3 years isn't adequately compensating for a contract that loses money every day. The scheme just isn't working. It's recruited 2 dentists, 2 in the whole of Greater Manchester, neither of which is in my constituency. What more can the Minister do to make sure my constituents get the dentists they need where they need them?
Yeah. I thank her for that question, and she's absolutely right to raise the issue of the contract. The fundamental problem is that the units of dental activity system is a contractual system that does not work for NHS dentistry. That is why we had the absurd situation when we came into office in July 2024 that there was a £392 million underspend on NHS dentistry because dentists weren't incentivised. We're changing that. I've got the underspend down to 36 million. There's still a very long way to go, and we need to reform the long-term contract to incentivise dentists to do NHS dentistry.
Whereas, Mr Speaker, access to NHS dentistry remains too difficult in rural and coastal communities like South East Cornwall, where residents face long travel times and limited provision. So would the Minister meet with me to discuss what next steps we can take to improve local access?
I thank her for that question, and she's absolutely right that there are areas of the country, as we know, that are known as dental deserts. We have to fix that. It comes back again to the fundamental issue about how to incentivise dentists to do NHS dentistry, regardless of where they are in the country. But there are particularly acute pressures in constituencies such as the one that she so brilliantly represents, and I'd be happy to meet her to discuss it further.
Elsa Blunden.
Question 14.
Minister.
Thank you, Mr Speaker. We know men are less likely to seek mental health support and suicide rates are higher in men, and we are taking action to address this. Through our men's health strategy, we've launched a partnership with the Premier League to improve mental health literacy. The Suicide Prevention Support Pathfinders programme will invest up to £3.6 million in areas where middle-aged men face the greatest risk of suicide, the North West being one area with some of the highest rates.
Elsa Blunden.
Mr Speaker, and I welcome the publication of the Men's Health Strategy, especially the measures in it designed to improve mental health outcomes. In a report that I recently sent to the ministerial team following an event that I held with local charities and mental health service users, it became really clear that the recommendations of that strategy need to be implemented quickly. What practical steps are therefore being taken to implement those measures, especially in areas like mine, where deprivation continues to really affect the health of men and boys?
I warmly welcome my honourable friend's report, and can I thank her for all her work on behalf of her constituents. Locally, NHS and council partners are supporting delivery through services like Thrive, Thinking Ahead Talking Therapies, alongside community initiatives such as Male Health Survivors at the Dale and Andy's Man Club, Rochdale, supporting men's mental health. We also have a mental health call for evidence, which is now live until the 12th of July, seeking practical examples to tangibly improve outcomes and inform our mental health strategy. And I would be very keen to work with her on what more we can do.
Tim Farron.
Mr Speaker, the suicide rate amongst men in Cumbria is twice the national average. There are a whole range of reasons why that is so. One of them is clearly bound up in isolation and rurality. I wonder whether the Minister will be willing to meet with myself and the Farmer Network as we seek to deliver mental health answers to people struggling. Often, when you've got 25% of farmers on less than the poverty rate, when you've got people who are isolated, dealing with transition at times of enormous stress and anxiety with nowhere to turn, would she agree to meet with me in the Farmer Network so we can address this particular cause of this appalling tragedy in our county?
Can I thank my honourable friend for raising that really important issue? And of course, we must not overlook the needs, especially with farmers, as he raised. And our men's health strategy has invested an extra £3.6 million in suicide prevention work in the most deprived parts of England, where men face the greatest risk of suicide. And the partnering work that we're doing with the Premier Leagues together against suicide initiatives to meet men where they are on their term, so they don't suffer in silence. And I'd be really, I look forward to working with him and meeting with him to hear more about this.
Lewis Cocky.
Thank you, Mr Speaker. Question 15.
Thank you. Mr Speaker, the NHS Modernisation Bill will clarify and strengthen accountability in the NHS. It ends fragmented accountability that we inherited on coming into government, and the reforms will restore clear democratic accountability with the Secretary of State directly accountable to Parliament and the public, and we will enhance local autonomy, ensuring NHS organisations are good partners and deliver for their local populations.
Lewis Cocky.
Thank you, Mr Speaker. We need more local accountability in the NHS. In Broxbourne, we've seen thousands of new houses built, but when I and local Conservative councillors have pushed for new healthcare facilities to cope with the new demand, we have been refused. Can the Minister explain, under their new system, who will be accountable for that?
He highlights a situation familiar to many of us, one of the many problems that we inherited from the last government with this fragmented landscape. So I thank him for his question. And the ICB, clearly responsible for commissioning for their population to improve access to healthcare and reduce inequalities. That's absolutely a key part of their responsibility. And they will be held accountable through the outcomes framework. It's the first time ICBs will be held accountable through that process.
Ellen Dolan.
Mr Speaker, Jules Fielder from Hastings was diagnosed with stage 4 terminal lung cancer after doctors missed her symptoms, mistaking them for tennis elbow. As a non-smoking young woman, she was not meeting the stereotype of what lung cancer patients often present with, but she was determined to channel her own tragedy into change. She campaigned for better, earlier awareness among clinicians and members of the public of symptoms, and she took this message to everyone she could. Together, we convinced Boots to roll out on-shelf awareness labels in the cold and flu medicine section to raise better awareness. And sadly, Jules passed away last month. Will the Minister join me in paying tribute to all of Jules's campaigning and commit to continuing her vision in the Department of Health of making sure we use every possible avenue to raise better awareness and catch cancer earlier?
Well, I thank her for raising that example of tremendous public service in the face of the adversity, and obviously we are sorry to hear of Jules passing, and our thoughts are with her friends and family. But she does highlight the way in which people can access and determine outcomes, and it is the responsibility of those working in local health services, particularly in this case the ICB, to have that way of involving people and actually using their experience to drive change that we want to see as part of this health bill.
Question number 1.
Sarah State.
Mr Speaker, the NHS matters deeply to me, to every one of my colleagues and to people right across the country, and that is why we are not wasting a second in driving delivery and pushing forward with extending prostate cancer screening to protect men at most risk, appointing a new national maternity advisor to give every woman and baby a safe birth, accepting the Mann Review recommendations to rid the NHS of anti-Semitism and all forms of racism, and of course, with my honourable friend, the member for Bristol South, taking the NHS Modernisation Bill through its second reading last week. As Secretary of State, I am determined to accelerate modernisation and build an NHS that is fit for the future.
Thank you, Mr Speaker. Following power outages at Eastbourne District General Hospital that left operations and births suspended, hospital bosses submitted a strategic bid of over £10 million to the Estate Safety Fund to urgently fix this, which was rejected. So how does the Secretary of State expect our hospital to provide consistent and safe care to patients without the power going out?
Mr. Speaker, I'm aware of the issues at Eastbourne District General Hospital, and patients, staff and visitors deserve better than power cuts and electrical failures. But that is why this government has set out a credible and deliverable plan to deliver the new hospitals programme. And I would gently remind the honourable gentleman, Mr. Speaker, and his constituents that many of the problems the NHS estate faces today stem from the NHS being starved of £37 billion of capital investment in the 2010s when the Lib Dems were in government.
Mr. Speaker, one of the biggest barriers to accessing community healthcare in Bracknell Forest is when constituents are told they aren't able to get routine diagnostic procedures done at their local GP or health centre and instead had to travel. One constituent with cancer was told he had to go to Guildford for a simple blood test. How will the introduction of a single patient record help break down some of these barriers?
I thank him for this question. And the single patient record gives clinicians that timely access to a single trusted record so that decisions can be made more efficiently, avoiding duplication, and people can spend more time with patients. And the system which makes all of a patient's information accessible in a single place will allow the sharing of patient data between different settings, as he outlines, and allow services to have more flexibility where services are made available.
Secretary of State Stuart Andrew.
Can I begin by welcoming the Secretary of State and the Honourable Lady to their places? Mr. Speaker, the Secretary of State was in the Treasury when it imposed VAT on compassionate access medicine programmes. These are programmes which, for some patients, especially children with cancer, provide a vital last chance to access treatment. The policy has already led to the closure of one scheme. Will he now commit to abolishing this tax before any more follow suit?
Well, Mr. Speaker, one thing I learnt when I was in the Treasury is that decisions about tax are taken by the Chancellor at fiscal events. So I'm certainly not, in my new role, going to start taking decisions about taxation at the dispatch box today. But the broader point here, Mr. Speaker, is how important it is to make sure we have the medicines that we need for the future. And that is why this government is investing so much in research, development and innovation to make sure we have those drugs that we need, we have the medicines we need to make sure we have the healthiest possible population in the future.
This needs decisive action now. These drugs are absolutely critical to some children. This cancer drugs tax has already closed one scheme, and companies are making real-time decisions now about whether to continue programmes in the United Kingdom. He must urgently get Treasury to permanently exempt compassionate medicines so patients in most need can get the vital drugs, because in some cases, it is simply their only hope.
Mr. Speaker, I've explained the position about decisions in relation to tax, but more broadly, Mr. Speaker, it is critical that we have the medicines of the future that we need. And one of my very first visits as Secretary of State for Health, Mr. Speaker, was to visit a company who are using AI to determine new opportunities for medicines and drugs to tackle cancers and some of the other illnesses that people face. Making sure that we're investing in businesses, British businesses, to drive that innovation is crucial not just to the future health of our country, but also to economic growth.
Mary Glendon.
Mr. Speaker, at the age of 6, Eric Slake was diagnosed with metachromatic leukodystrophy. MLD is treatable if diagnosed early. His parents, Tracy and Luke, are campaigning for newborn screening for the disease. In its last review of the condition, the National Screening Committee did not recommend screening, but outlined it is gathering more evidence. Will the Minister look at ways this process can be expedited?
Can I thank my honourable friend for raising this very important matter, and my sympathy is with the Lake family and I commend them for their advocacy on this issue. I am acutely aware of this matter, having met with the member for Upper Ban and her constituents on this issue last week in a very moving meeting. I can also assure my friend that the department is working with partners to see whether it is possible to set up a multi-condition evaluation so that not only MLD but other rare conditions can be assessed alongside the existing screening programmes.
Morgan, Liberal Democrat spokesperson.
Very much, Mr. Speaker. A damning report by the Royal College of Emergency Medicine has estimated that there were more than 15,800 deaths associated with long waits in emergency departments in 2025, a figure that I think we would all agree is an outrage. But the government still hasn't published reliable data on long waits in corridor care, despite promising to do so by the end of May. So will the Minister tell the House what the government is trying to hide, and will they adopt Liberal Democrat calls to end corridor care within a year by freeing up beds throughout hospitals and in social care to end the blight of excess deaths in overcrowded A&E departments?
Mr. Speaker, let me be clear that corridor care is unacceptable, undignified, and we are committed to eradicating it. Mr. Speaker, we have begun by getting specialist teams to go into the worst offending trusts to make sure we are getting rid of corridor care in those places. The NHS now has a national definition of corridor care for the first time ever. We will publish data on that shortly because I believe, Mr. Speaker, that the first step in getting a grip of the problem is to be open and transparent about its scale.
Nadia Witt.
Mr. Speaker, we all know that social care is in crisis, with huge staff shortages, unmet needs, and councils' finances being pushed to the brink. So it's disappointing that the King's speech didn't contain anything on social care. With the full Casey review not expected until 2028, and implementation estimated to take up to 2036, what steps is the Minister taking now to alleviate pressures in the system? And will the government expedite social care reforms so we can meet our manifesto commitments on a national care service?
I thank my honourable friend for that question. I pay tribute to her in terms of the work that she did formerly as a care worker. This government inherited a social care system in desperate need of reform, and we are taking action, including providing over £4.6 billion of extra funding for adult social care by 28-29 and developing the first ever fair pay agreement for care workers. Baroness Casey will submit her first report this year with recommendations on the further action we should take to move towards a national care service.
Mr. Speaker, despite rising nationally, the number accessing NHS dentists in South Gloucestershire is falling, with less than a third of adults and half of children having been seen by an NHS dentist in the last 2 years. With no NHS dentists taking on patients and more going private, how will the government reverse this decline?
I thank her for that question. As I said to her honourable friend earlier, the fundamental long-term reform of the contract is vital to incentivise dentists to do NHS dentistry. But I am also very pleased by the fact that we have really put downward pressure on the underspend. And as a result of that, we're on track to deliver more than 2.5 million extra dental treatments than in the same period before the general election.
Thank you, Mr. Speaker. I recently held a health roundtable in Purbeck, and here volunteers from Parkinson's UK made clear that more needs to be done for all those living with the illness, and so they receive the robust support that they need. There was particular concern that a shift away from routine checkups could mean that many do not regularly see an experienced practitioner. Will the Minister work with me to ensure that the voices of people living with Parkinson's are listened to and their concerns are acted upon when any changes are made to the care that they receive?
People with Parkinson's disease should receive support tailored to their individual needs as symptoms progress. As symptoms and progression vary. The NHS provides specialist multidisciplinary NHS care informed by NICE guidance and improvement programmes such as Getting It Right First Time. People with Parkinson's will benefit from our wider work to strengthen community services, reducing waiting times and improve coordinated person-centred care closer to home. So I can assure the Honourable Gentleman that the Department will continue to meet regularly with Parkinson's UK to ensure their voices are heard.
Byfleet in my constituency of Woking lost its doctor's surgery in 2005, leaving residents having to struggle via the A245 to access basic health facilities that is set to get busier due to a likely housing development. Will the Minister agree to meet with me to ensure we can bring health facilities back to Byfleet again?
Well, I thank him for that question. We have got the £102 million utilisation and modernisation fund to enable more GP primary care estate. So that's an important point. Of course, we're also committed to delivering 120 more neighbourhood health centres by the end of this Parliament. So I hope that his ICB has put in an expression of interest for our neighbourhood health centre scheme, and I'd of course be prepared to discuss that with him further.
Debbie Abrahams.
Thank you, Mr. Speaker. There's overwhelming evidence, there's overwhelming evidence that marketised health systems, such as the NHS has become, actually increase health inequalities. So will the Health Secretary consider amendments to his health bill which will tackle the rising inequalities in existing health policies, including allowing local health and NHS organisations to determine if they need additional private sector capacity?
Well, I thank my honourable friend for that, and I commend her experience in this area. We don't have plans to, particularly, she tempts me to look at amendments in that space at the moment. The changes that we make to NHS England place that responsibility firmly at the Secretary of State's doors on health inequalities in all our policies. I'm very happy to talk to her about other ideas that she has around that. The bill transforms that responsibility onto the Secretary of State, so we have no plans to make any changes in that area.
Alison Griffiths.
People in West Sussex are unable to access an NHS dentist, and many constituents in Bognor Regis and Littlehampton tell me they have been unable to secure an appointment for years. So what specific steps is the Secretary of State taking to increase NHS dental capacity in coastal communities, and when does he expect patients to see a measurable improvement?
Well, I thank her for that question. I've said to honourable members across the House today, there is the fundamental challenge around the dental contract. The units of dental activity doesn't work as a way of incentivising dentists to do NHS dentistry. So that fundamentally has to be fixed. But I am also very proud of the fact that thanks to the measures we've put in place, 2.5 million additional courses of treatment have been delivered compared to the same period before the general election.
Fairness.
Last year I had the opportunity to witness a TAVI procedure. This is a really groundbreaking procedure for people who require valve changes. I saw this, it was quite incredible, and I would recommend all of you go and see this procedure over in St Thomas's. The patient was 82, had been bedbound for weeks, but after that 20-minute surgery they were fit enough to be discharged later that same day and look after themselves. This has a massive impact, not just on the patient's life, but also for our NHS and the wider economy, as illustrated by Hartwell Klaus's Optimal Pathway report. What steps is the department taking to not just on the patient, so to ensure NHS systems identify and treat?
I am aware of my honourable friend's significant work in this policy area, and she is absolutely right about the huge potential of TAVIs. Rise in national TAVI activity and improved getting it right first time pathways are part of our approach to reduce health inequalities and supporting more timely, equitable care. And through this work, the Government is committed to strengthening consistency in the diagnosis and treatment of heart valve disease, building on progress already made.
Phil Pinkerton.
Thank you, Mr. Speaker. The relocation of Frimley Park Hospital in my constituency is a £1.8 billion project, but none of the costs of the essential infrastructure to enable this new site to go ahead have been costed or budgeted for. The chief executives of the hospital simply have said that those costs will have to come from the new hospital programme contingency fund. Does the Secretary of State agree with me that that is no way to start a project of such size, scale and significance, and would he meet with me to address those concerns?
Mr. Speaker, the honourable gentleman is persistent in raising this. He's raised this with me in the lunch queue as well. This is clearly an issue which I know matters to him and to honourable friends on my side of the House as well. But I think we need to
just say to the honourable member, when he's answering the question not to meant to walk in front, please show respect to each other. Secretary of State.
But, Mr. Speaker, the honourable gentleman can rest assured that this government is focused on the new hospitals programme, which is now credible and deliverable after what we inherited from the previous government, and we will get those hospitals in place.
Christine Sullivan.
Thank you, Mr. Speaker. On Thursday, I will chair the Endometriosis APPG's first evidence session of our inquiry into endometriosis in the workplace, and we will look at the experiences of women living with the condition, the lack of timely treatment for chronic symptoms, and how this impacts them in the workplace. Will the Secretary of State commit to reviewing our recommendations once published later this year?
I commend the Honourable Lady for her great work and that of the APPG on highlighting the importance of endometriosis and the impact. We would be delighted to continue our close engagement with you and the APPG on this topic. We will consider the APPG's findings carefully when they are published as part of our ongoing work to improve diagnosis, treatment and support for women with endometriosis.
Helen Maguire.
Speaker, Epsom and St Helier hospitals need urgent funding now, not just patchwork repairs. In 2024, 600 operations were cancelled due to ventilation issues, and this situation is only going to get worse. So will the Minister address the backlog of hospital repairs now to ensure patients and staff have safe and modern facilities in Epsom and St Helier hospitals?
Mr Speaker, under this government, we have increased capital investment in our NHS estates, including hospitals, because, frankly, under the previous government, that was sorely lacking and stored up problems that we are now experiencing today. There is a huge amount that we need to invest in to make sure our NHS is fit for the future, but we also need to reform the service, which is why modernising the NHS is a key priority for me and this government.
Chris Webb.
Thank you, Mr Speaker. At the beginning of the year, Blackpool had the worst 12-hour A&E waiting times in the country, but thanks to the tireless work of local NHS staff, that's been reduced by 43%. However, we face some of the biggest challenges in the country with health inequalities, deprivation and the 21 million visitors that come every year. So would the Secretary of State agree to meet with me and our CEO of the hospital to talk about what support we can get to bring these numbers down so that residents in Blackpool can get the care they need?
I thank my honourable friend. I'm very happy to work with him to tackle health inequalities in his area. As he rightly highlights, our investment in the NHS and in the wider health of the nation is specifically about tackling health inequalities such as those that he raises and which affect the life chances of his constituents.
Joe Robertson.
Thank you, Mr Speaker. The crisis in social care is particularly bad in my constituency on the Isle of Wight, partly because of our unique geography, but also because the government has reduced funding to our local authority. And our council is now looking at discharging patients to the mainland away from family and friends, which is completely unacceptable. Will the government recognise our unique challenges as an English island and help provide a social care solution which recognises those challenges that we face?
I thank him, and we have discussed this issue, and I absolutely recognise the need to ensure that social care is provided in the most convenient way that is possible to his constituents and as close as possible to home. Obviously, we are fixing a broken system, but we have delivered £4.6 billion more of funding. We're delivering the Fair Pay Agreement, and we're working hard to ensure that we get adult social care back on its feet and fit for the future.
Justin Mathers.
My constituents were delighted to see the opening of the Great Sutton Medical Centre, but it has brought into sharp focus the need for an urgent upgrade of GP practices in Ellesmere Port Town Centre. I've submitted an expression of interest for the Neighbourhood Centre programme. I wonder if the Minister would agree to meet with me to discuss that further.
Well, I thank him for that question. I'm delighted that he submitted the expression of interest. We're now assessing proposals against criteria, including fit with our national neighbourhood health strategy, sound estates planning, deliverability, sustainability and critically local need. And we'll be prioritising areas where there is low life expectancy, higher deprivation. So I'd be delighted to meet with him to talk about his expression of interest and about our programme for revolutionising care in our country through the shift from hospital to community.
Thank you, Mr Speaker. Unpaid carers play an absolutely crucial role in supporting so many people who need to draw on social care, thereby supporting our health service and our formal social care system. But they tell me they're under immense strain. They need more support. And they are, of course, more likely to be women and more likely to be older. Does the Minister recognise the urgent need for more respite care for unpaid carers? And will he take action to provide it now, not waiting a few years for the Casey Commission?
I thank her for that. She's absolutely right that unpaid carers are the lifeblood of our care system, and we pay tribute to them for the compassion that they show. I was very pleased that yesterday I accompanied the Minister from the DBT to launch the new Paid Carers Leave consultation document. I'm also very pleased to chair the cross-ministerial group that is going to produce an action plan for unpaid carers, addressing exactly the issues she mentioned about respite care.
Jen Craft.
Thank you,
Mr Speaker, last week the Supreme Court judgment that overturned Cheshire West, the previous judgment on the Mental Capacity Act, has thrown the sector who care for people with learning disabilities and or autism into what they have called chaos. There is significant concern that without further clarification as to whether someone can consent to deprivation of liberty who does not have mental capacity will lead to putting vulnerable people at significant risk. Will the Secretary of State listen to calls for...
Sorry, I've got to get through. I've other members again. You've got to shorten your questions to help me. Secretary.
Mr Speaker, I can reassure my honourable friend that the Government respects the Supreme Court decision. We are considering it very carefully and we will set out updated guidance shortly.
Paul Holmes.
Thank you, Mr Speaker. Waiting times for cataract operations in my Hamble Valley constituency are rising hugely because the local ICB and its AI system have stopped offering all providers it advertises and have scrapped their contract with Specsavers, meaning only GPs can diagnose the problem. Will the Minister have a look at the local problem and intervene so that we have the widest and best possible providers to reduce those waiting lists?
He's absolutely right that getting the link between high street optometrists and secondary care working more effectively is vital. That's why I was very pleased to announce the £20 million e-referral investment earlier this week. We're also working on single point of access to get that digital interface working far more effectively, and he's right that we should be focusing on that more, and there's a lot more to do.
Adam Thompson.
Thank you, Mr Speaker. I want to raise eating disorders in relation to extreme exercise using app-based fitness classes, particularly people with very low BMI doing ultra-high intensity exercise for hours every day, and how these apps can become addictive. When I wrote to one brand asking about implementing access limitation tools in their app, they were dismissive. Will the Secretary of State then consider reviewing whether such tools could be mandated to support those with eating disorders?
Well, Mr Speaker, I thank my honourable friend for raising this issue because it's an important angle on a problem I think we're all aware of, but facing a slightly different context given some of the modern features which are available on devices in our pockets. So I thank him for raising that. I'll look into it further and pick up with him in due course.
Seamus Logan.
Mr Speaker, many members in this place will be all too familiar with the trauma of a miscarriage. For some, this tragedy occurs more than once. Scotland is the first nation in the UK to implement a miscarriage patient charter based on the so-called Tommy's graded model of miscarriage care. Could the new Secretary of State, and I welcome to his place, could he outline whether the Westminster Government are considering replicating that system here in the rest of the UK?
Well, I thank the honourable gentleman for raising an incredibly sensitive and important issue in his question. We want to make sure that as a government, through the NHS, we're supporting women who suffer miscarriages and their families. We will make sure that we have the right provision in place to support them, and that the NHS and the wider health system is there for them when they need that help.
Sadiq Kumar.
Thank you, Mr Speaker. Dudley has high levels of deprivation and health inequalities. That's why I'm campaigning to bring healthcare on Dudley Town High Street. Can the Minister meet with me to discuss how we can leverage the 10-year plan to reduce these health inequalities in Dudley? And does he agree that we need a healthcare hub?
Well, I would definitely agree that my honourable friend is a formidable champion for her constituency, and she's absolutely right to raise the importance of making sure healthcare is easily accessible in places like high streets where people can access it easily. I'm very keen to make sure that the Neighbourhood Health Centres programme, 250 of which we've announced, 120 by 2030, are delivered as quickly as possible, and that's part of our plan to make sure that healthcare gets right into every local neighbourhood and community, and I look forward to discussing that further with my honourable friend in the future.
Sir Desmond Swain.
May I have a meeting to discuss my Parents, Carers and Babies Bill, which affords support to the Best Start Family Hubs and Healthy Babies programme?
I thank the honourable gentleman for that question, and we know that the earliest stages of a child's life are critical for their development, and the government is committed to supporting families to give babies the best start in life, and we are investing over £900 million in Best Start family hubs and healthy babies to create an integrated, accessible system of support for families. I particularly look forward to considering the merits of the Right Honourable Member's Private Members Bill that he presents to Parliament, and I would indeed look forward to meeting with him to discuss that further.
Dr Rupert.
There's 500,000 celiac sufferers in the UK, but there's little understanding of the condition that's massively underdiagnosed. So can I invite everyone here, even you, Mr Speaker, to the drop-in that I'm doing on Tuesday the 16th with the campaign? And in particular, can they have a follow-up meeting with my honourable friend, the Minister, the member for Gateshead and Washington, as she has been a long-standing advocate and gets it?
Well, I thank my honourable friend and neighbour for her question today, and it's very welcome that she's raised this matter in the Chamber, drawing attention to so many members on both sides of the House. I don't want to speak on behalf of my honourable friend, but I'm getting a nod from my friend, the Minister. We should be happy to pick this up with you in future.
That completes questions. We've got statements, haven't we? We've got statements. Yeah, these points of order come after statements.
Thank you.
Take care. Now come to the urgent question. Gavin Robinson.
Thank you very much, Mr Speaker. I wish to ask the Secretary of State for Northern Ireland if he will make a statement on reports of a serious, violent attack in North Belfast involving a foreign national and the implications for public safety, immigration enforcement and community cohesion.
Mr Speaker, I'm grateful to the Right Honourable Gentleman for his question. Shortly after 10:30 p.m. last night, a man in his 40s was subjected to an horrific, sustained knife attack in a street in North Belfast. He is in hospital in a serious condition, having suffered very severe injuries. I know the thoughts of the whole House will be with him and his loved ones at what must be a time of unimaginable distress. The response from the Police Service of Northern Ireland was immediate. A man in his 30s was arrested on suspicion of attempted murder. He remains in police custody, and the PSNI are continuing to investigate. They have declared it a critical incident. But amidst the horror of what happened, we also saw something extraordinary. When confronted with scenes of terrifying violence, members of the public did not walk on by. Instead, a number of them stepped forward, and at immense risk to their own safety, they intervened to pull the assailant away and protect the victim until the police arrived. To those individuals, I would like to say this. You showed the very best of humanity, and you have the profound gratitude of this entire House. This was a horrific and brutal attack, and the PSNI are seeking to provide support and reassurance to the local community. The Chief Constable, to whom I have spoken twice this morning, and his officers have our full, unwavering support as they pursue their inquiries. I would also like to repeat their appeal not to share or repost footage of the attack out of respect for the victim's family. Mr. Speaker, I echo the words of the Prime Minister this morning that there is no place for such violence on our streets. All of us have a responsibility now to urge calm and let the police do their job.
Gavin Robinson.
Mr Speaker, can I firstly thank you for granting this urgent question. The attempted murder in Belfast last night was chilling. What has been seen by thousands already across the country cannot be unseen. It was medieval. The systematic mutilation and attempted slaughter of a citizen of Belfast on our streets. Mr. Speaker, my prayers are with the victim, and I similarly praise the brave man who, with a hurl in his hand, intervened to save his neighbour's life, and this House should praise him too. Mr. Speaker, what occurred last night will have profound implications for community cohesion in this country. This needs to be a time for honesty and openness and truth. Will he confirm that he and his government recognise that uncontrolled immigration needs to end? Will he confirm that the government needs to reassure and protect our population who for too long have had their concerns ignored? And knowing that he and the Chief Constable and I share a concern that there could be violence, and express my wish and our collective desire for calm, that community cohesion lies on the precipice. Will he confirm that the actions last night in no way reflect or represent the values of our nation? That the victim belongs in Belfast, but the attacker does not? Having abused the privilege of our nation, the perpetrator living in the UK under a 5-year visa needs to be convicted and deported on the first flight out on a one-way ticket.
Well, I would say to the right honourable gentleman, first of all, the footage that many people have seen is indeed truly horrifying. On his last point, as he will be well aware, any foreign national who abuses the hospitality of this country to commit crime should be in no doubt of our determination to deport them. We need to allow the criminal justice process to take place. On his question about net migration, as he will know, it is now down 82% from the peak reached under the previous government. But I would most particularly echo what he has said in appealing for calm, because we have seen previously in Belfast in August 2024 and in Ballymena in 2025 what happens after horrific incidents when there is disorder on the streets, because it is the communities that suffer, it is innocent people who suffer and whose lives can be put at risk. And that is why all political leaders have such a solemn responsibility to urge the calm that I have called for in my response to his question today.
Chris Ball.
Thank you, Mr. Speaker. Can I thank the Secretary of State for his statement, and can I also thank my right honourable friend for asking the question. As a member of the Northern Ireland Select Committee, I've visited Belfast on several occasions and have been struck by the incredible nature of the community spirit and the incredible city. What we witnessed last night is the worst of humanity, but also the best of humanity. I think it is incredible that bystanders came to the aid of that individual suffering a brutal attack. Can the Secretary of State assure me that the PSNI will be given every resource they need to conduct a swift investigation and ensure that all facts are shared with the public? And can we also ensure that those brave people who rushed to the aid of one of our own countrymen is given the honour and the reward that they deserve for representing the best of our humanity?
State.
Well, I say to my honourable friend that I know from the conversations I've had with the Chief Constable this morning that the PSNI are treating this, of course, as the House would expect, with the utmost seriousness and are pursuing their inquiries. We need to let the police investigation and in due course any criminal justice process take its place. I am in favour of as much information being shared as soon as possible, and I would report to the House, Mr. Speaker, that the PSNI will be holding a press conference in approximately 5.5 minutes' time to provide more information about the incident I also join my honourable friend in expressing hope that the bravery that we saw on the streets of North Belfast last night may in due time be recognised.
Minister Matt Vickers.
Thank you, Mr. Speaker. I'd like to echo the Secretary of State's comments in condemning this dreadful attack. Last night's attack in North Belfast was horrifying, appalling and deeply disturbing. This was a brutal act of violence that will have sent shockwaves through the local community and caused huge concern across the city, Northern Ireland and the whole of the United Kingdom. My thoughts, and I'm sure those of the whole of the House, are with the victim whose condition has been described as serious. I also want to pay tribute to the PSNI and members of the public who displayed remarkable courage in stepping in to confront the attacker before the police arrived. The police service of Northern Ireland must be given the time and space to carry out a full and thorough investigation, and those responsible must face the full force of the law. However, given the understandable public concerns surrounding the incident, it's vital that the facts are established and we have the transparency that people deserve. Can the Secretary of State confirm the immigration status of the attacker? If, as is reported, the attacker is a foreign national, what steps will the Home Office take? It is urgent the facts are put on the public record to avoid speculation and prevent an information vacuum which the Independent Review of Terror Legislation has warned about. If there has been failings on our borders, this is yet another reminder that we do need stronger borders, and this is why we believe it is time to leave the ECHR. I encourage all who have evidence of the attack to come forward and support the PSNI in its investigation. I join the Secretary of State and all communities in condemning this horrific attack.
Secretary of State.
Well, I'm grateful to the honourable gentleman for his comments and for the tone in which he expressed them, because it is, I think, very important that we act responsibly in these circumstances. I agree, as I've already indicated, that information should be made available to the public. The proper procedure in answering his very specific question is for the PSNI to be in contact with the Home Office, which I know they have been doing, in order to establish the facts around the individual. And I would anticipate, as I say, it's proper that the police provide that, as they are leading the investigation, and I anticipate that more information will be made available shortly by the PSNI, is the right and proper approach. I would have to say, however, I do not agree with what he said about the European Convention of Human Rights. It's very important. We have it because it protects the liberty of all of us.
Dr L. Pinkerton, Liberal Democrat spokesperson.
Thank you, Mr. Speaker. The reports from Kinnaird Avenue are indeed deeply distressing. My thoughts are with the victim and with his family. I pay tribute to the residents who did the extraordinary thing of running towards danger, intervened to restrain the attacker and help protect another person's life. I also thank police officers and paramedics who responded with such speed and professionalism. Their actions almost certainly saved a life yesterday evening. What I know of North Belfast is that it's a community that has worked hard to build trust across long-standing divides, and that residents will be as horrified by this attack as the rest of us. Will the Secretary of State reassure residents that they will be kept safe in the days ahead, confirm that the PSNI have the support that it needs to maintain a visible presence, and make clear that no one should exploit one individual's actions to cast suspicion on a whole community?
Well, I agree with the honourable gentleman in everything that he said, and I know that the PSNI is working hard to provide reassurance to the local community and to make arrangements for that reassurance to be visible. In the face of those, let us be frank in this House, who will wish to use this terrible event to stir up trouble and to seek disorder on the streets of Northern Ireland. And I say that because we have seen it before. We do not wish to see it again, and that is why all community leaders, politicians and others have such a responsibility to call for the calm that he himself has so eloquently called for.
Jim Shannon.
Thank you, Mr. Speaker. Can I, first of all, thank the Secretary of State for his well-chosen words, wise words as well, and for his answers. Tensions are inflamed, and at this moment I'm aware of planned protests throughout my constituency of Strangford, and I'm also aware that many of those who intend to attend do so not because they are frightened for their family alone, but instead feel their fears are ignored when they make a good and grand statement. So how can the Secretary of State and this government ensure that people from Portavogie to Newton Ards know that their right to peacefully protest is respected, but more than this, that their government, my government, will make changes for safety reasons as a matter of urgency? Thank you so much.
Okay.
Well, I join with the honourable member in reasserting the right of every citizen of our country to protest peacefully. But we have seen in the past that there are those, provoked by others, who sought to use that opportunity to then promote violence and disorder. And I join with him in saying peaceful protest, of course, everyone has the right to express their view. But in the end, if we want to support the PSNI, the last thing people should be doing is stretching their resources across Northern Ireland to deal with protests that aren't going to help anyone and are not going to assist in the furtherance of this investigation, so the perpetrator can be brought to face justice. That is the way we do things in our country, is it?
Jim Allister.
Thank you, Mr. Speaker. We're all shocked by the sheer savagery of this attack, and indeed the only bright spot in this orgy of violence was the brave intervention of local citizens whose courage we salute. But what I want to know, and what I know my constituents want to hear, is what will be done to stop the importation of an alien culture that thinks it's appropriate to try and behead someone within the United Kingdom. And on the immigration status of this person, did they hold a visa before they came to the United Kingdom? Did they obtain a visa having come illegally to the United Kingdom? I think we're entitled to know. And I do say to the Secretary of State, this House should be getting its information from the Secretary of State, not from the press conference of a Chief Constable. And I think the House is entitled to know, because it's truth and transparency which is the greatest antidote to rising tensions. So can we have the answers?
Secretary of State.
Well, I would say I'm sorry that the honourable gentleman used the word alien culture, because what exactly is he referring to? What the British people have had enough of, are anyone from wherever they come, whatever their background, who seeks to commit violence on citizens of the United Kingdom. That is what we together are strongly opposed to. There is a proper procedure that needs to be followed in relation to the release of information. It is a live investigation. I think it is right and proper that the police lead on that, and that is why it is the police who have been in touch with the Home Office and will provide further information. And as soon as I am also able to update the House, I will do so. I am also in favour of as much information as possible being provided once the process has been followed to make sure that it can be confirmed.
Julian Lewis.
Whilst I agree with virtually everything the Secretary of State said in his opening response, I really am baffled by his refusal to share with the House a piece of simple information. Did this person come legally into this country and has a 5-year visa because he came legally, or was he given this visa after entering the country illegally? This information will come out sooner or later, and what we have learnt from similar terrible incidents like this is the longer it is withheld, the worse the rumour mill goes into action.
Well, I do understand the last point that the right honourable gentleman makes, but it is very important in these circumstances to be absolutely sure about the facts before they are released. And the proper vehicle for doing that is the PSNI being in touch with the Home Office, which is what has been happening this morning. As the right honourable gentleman may be aware, the police originally said they believed him to be of one nationality. It may well turn out that he is in fact of another nationality, which does demonstrate the point I'm trying to put to the House, that it is important that the police lead on that so that the full facts can come out and then they can be made available to the House and to the country.
Lee Anderson.
Mr. Speaker, of course, the Secretary of State will know the answer to this question. Did the assailant enter the United Kingdom as an illegal migrant stroke asylum seeker?
Well, until I am in a position, by talking to the honourable gentleman's asked me a question, would he do me the courtesy of allowing me to answer it? Until I am in a position to have that confirmed, I cannot confirm it to the House. As soon as I can, I will. But as I've already explained, it is the PSNI that is leading on answering the very legitimate question that he has asked.
Robin Swan.
Thank you very much, Mr. Speaker. The Right Honourable Member for East Belfast described this incident as medieval. It wasn't just medieval, it was pure evil when we saw what happened on the streets of the United Kingdom. And while tribute has been paid for those members of the general public who stepped in and the emergency services that responded, can I also seek a reassurance from the Secretary of State that those members of the general public who stepped in will actually be recognised and not be persecuted or prosecuted for the actions that they actually took in regards to attacking that individual? And can I also encourage the Secretary of State to come forward and fill the vacuum of information that's out there, because he does know more than I think he is telling the House at this minute in time in regards to this incident.
It was an act of pure evil. I agree with the honourable gentleman in saying that. I'm surprised that he suggests there's any possibility of those who came to the aid of the victim should be at risk of prosecution because they were trying to save him when judging by the footage, when the attacker was trying to inflict great harm upon him. And my judgment, having looked at that, is what they did was proportionate and fair. But that is for others to judge. It is important that they are recognised. I've already indicated the House. As soon as I have information that is confirmed and which I can be sure of, I will inform the House.
Gregory Capp.
Thank you, Mr. Speaker. Tens of thousands of people are horrified at the circulation online of the video that the Secretary of State has alluded to. And while he quite rightly congratulates the members of the public who intervened, and they did, whether it was a hurl bat or a cricketing bat, they took action. But what we need to see now, as tension rises, we need to see government action to restrict and inhibit people arriving in this country illegally, some of which carry out the actions that we saw on the streets of Belfast last night.
Well, the honourable gentleman will be well aware of the action that the government is taking to deal with illegal migration. And I've also made clear to the House the steps we take if anyone, however they came to the country or whether they are from this country, commits a criminal offence, they will face due process. And any foreign national, regardless of how they came, who abuses our hospitality and commits crimes, can expect to be deported at the end of their sentence.
Cole Lockhart.
Thank you, Mr. Speaker. My thoughts are very much with the victim of this horrific attack last night, and I want to also echo the calls for calm in our communities. Communities in Northern Ireland are angry, they are demanding answers, and they deserve answers. Sadly today, I don't feel they're getting those answers, and it's not lost on the people of North Belfast, who is in this place today speaking up for working class communities who are very concerned about uncontrolled immigration and the fact that many houses now, that mayors won't even tell how many houses they have full of immigrants. So my question is, was this individual known to the authorities? How many other from the same country are currently being accommodated in Northern Ireland? How did they enter the UK, and what action this government is taking to prevent abuse of our immigration system, including via the land border within the Republic of Ireland?
Well, I say to the honourable member that the public are right to be angry about what they witnessed in that appalling video and what they have heard about the attack that took place. As I've already indicated to the House, I mean, some of the questions that she's asked, I will endeavour to come back to her on. Others will be provided in due course once the facts have been checked. It's really important that the facts are checked before information is given to the House, because I will want to stand here and say one thing, and it turns out that is not the case. So checking that thoroughly is a responsibility on me before I inform the House, and that is what I intend to do.
Ayub Khan.
Thank you, Mr. Speaker. Can I also echo the sentiments of members in this House in sending my thoughts and prayers to the victim of this horrific attack? And in specific, can I also extend my gratitude to the local community who bravely intervened? What we all must do now is encourage calm at this most troubling time and stop tensions from further being inflamed. And to that end, does the Minister agree that we must not let the heinous actions of one person be taken as an opportunity to taint an entire community, and that we should not and must not attempt to fill the gaps whilst the story and the police investigation continues to deliver justice to the victim and their family?
Well, I do agree with the honourable gentleman when he says that. And when I think back to those who were attacked in the wake of the terrible events in Southport and then in Ballymena, we know that in Northern Ireland, certain of individuals were attacked. It had nothing to do with any of this, simply because of the colour of their skin. And that is not what this country is about. Identify an attacker, due process in due course after investigation. Do not cast aspersions on a whole community. Many people from all backgrounds contributing so much to our national life.
Joker Adam.
Thank you, Mr. Speaker. I thank the Secretary of State for that answer. And following on, I myself also give my deepest sympathies for the victims and his family and pay tribute to the bystanders who intervene at this horrific case. Does the Secretary of State agree with me, as he has already expressed, further that crime and heroes come in all different hues and colours? Like we have seen in Cambridgeshire in the train, as the stabber of the Saudi student in Cambridgeshire in the picturesque streets last year. It doesn't matter which background you come from, and it's a responsibility for members in this House to temper their inflammatory remarks so we do not see actions like we did last week in Southampton, where innocent police officers are having to go into hiding.
Yeah. Well, I would say to the honourable member, we all have a responsibility by our actions and our words not to inflame. And we all have a responsibility, as I indicated in answering the Right Honourable Gentleman's original question, to plead for calm in these circumstances. That is the right thing to do on behalf of all the people of Northern Ireland.
Yeah. Richard Tice.
Thank you, Mr. Speaker. Calm is essential after this horrific, brutal attack. We all know that. The Secretary of State has referred to further information coming out as we speak. Will he therefore commit to returning to this House later today, if possible, to update the House on the important information around the suspect and any other information you hear?
I'm very happy to say to the honourable gentleman, I will report to the House in an appropriate form as soon as I am able to do so.
Right, that completes the questions. Let the front benches change over. We now come to the statement. Foreign Secretary Yvette Cooper.
Thank you, Mr. Speaker. With permission, I would like to make a statement on the Middle East, first on the Iran conflict and Lebanon, second on the situation in Palestine. And can I apologise to the Shadow Foreign Secretary and also to the Speaker and to the House for the delay in sending across the copy of the statement. Mr. Speaker, this weekend we saw worrying and dangerous escalation. Lebanese Hezbollah continuing to fire into northern Israel, Israeli strikes against southern areas of Beirut, and the direct exchange of missiles between Iran and Israel, presenting one of the most dangerous moments since the fragile ceasefire was agreed. Over the last 48 hours, we have made clear the need for urgent de-escalation, because a resumption of conflict is in no one's interest, and I spoke to the Iranian Foreign Minister on Sunday evening to convey this directly. Both Israel and Iran have indicated that they have ended their strikes, and that is welcome, but there was some reporting just before I entered the chamber of strikes again this morning. It's vital that we have a diplomatic way forward, both to end the conflict in Lebanon to reopen the Strait of Hormuz, to restore regional stability and prevent Iran ever developing or obtaining a nuclear weapon. As we have previously made clear in this House, Israel's recent escalation in Lebanon was reckless and disproportionate and deepened the humanitarian crisis that had already seen more than 1 million Lebanese people driven from their homes and thousands killed. But we strongly condemn Hezbollah's attacks against Israel, including its northern communities, because at Iran's instigation, Hezbollah, a proscribed organisation, is dragging Lebanon into a war that is against the interests of its people and its government. It must end this dangerous attacks and disarm. And the US-brokered ceasefire in Lebanon must be properly observed by all parties. We want to see a swift and successful conclusion to the ongoing talks between the US and Iran. We need an agreement that gets the strait fully open with no tolls or charges. And last week I discussed this with Foreign Minister Wang Yi in China and Foreign Minister Jaishankar in India. Every country has a stake in freedom of navigation, and the UK will continue to speak up for this across the world. And in partnership with France and other countries, we stand ready to play our part once agreement is reached to support demining and provide reassurance to shipping through a multilateral maritime mission. With cost of living pressures at home, we need a lasting settlement which delivers peace and stability in the region and the full restoration of global trade. Let me turn now to Palestine. 9 months ago at the UN General Assembly, I confirmed the UK's historic decision to recognise the State of Palestine. And we did so alongside partners in recognition of the inalienable right of the Palestinian people and to defend the viability of a two-state solution. We did so as part of a wave of international diplomatic energy in support of peace in the Middle East, and it was a crucial moment of hope that we could end the violence and suffering and begin to build a better future of lasting peace and security for Palestine, Israel, and the wider region. But today the situation is bleak, and the viability of the two-state solution remains in grave peril. Let me turn first to Gaza. The ceasefire remains formally in place, but it is being regularly violated. Since October, over 900 Palestinians in Gaza have been killed. 1.9 million Palestinians remain displaced and dependent on humanitarian aid, and aid is down this year, not up, with 90% of water and sanitation infrastructure destroyed and not rebuilt, families without shelter, a public health crisis with rodent infestations and communicable disease, and currently at barely half the level of the 4,200 trucks a week promised in the 20-point plan. Israel's registration law continues to severely restrict international NGO operations while key crossings remain closed. And it is a total moral outrage that children are still going hungry while food they need rots on shelves because aid agencies cannot get in. Meanwhile, Hamas decommissioning has not yet started, and they retain a tight hold on areas of Gaza. And instead of the phased withdrawal of Israeli troops, Gazans are restricted to just 40% of the territory, unable to access their land beyond the yellow line. And Mr. Speaker, we urgently need new international energy, new pressure, and new action to resuscitate the 20-point plan. For the UK, that means pressure in 3 priority areas. First, increased aid is urgent and must be unconditional. Despite all the challenges, UK aid is making a difference on the ground. Last year, we provided over £80 million of humanitarian and early recovery funding, with funding protected again this year, enabling 650,000 people to receive food and improving access to water, sanitation and hygiene for 300,000 people. UK support for mine clearance has enabled 45 acres of land to be made safe for community use and helped clear 24 key sites, including medical facilities. And today I can announce another further £1 million to support these mine clearance efforts. But some UK aid is still stuck in warehouses, including in Jordan and Egypt. And humanitarian support is a fundamental right. It cannot be bartered against other aspects of the peace plan. So the Netanyahu government must recognise its urgent humanitarian responsibility to open crossings and to end the arbitrary restrictions so the UN, UNRWA and international NGOs can fulfil their life-saving mandates. Second, we continue to press for the decommissioning of Hamas weapons to get underway. Hamas must destroy its terrorist infrastructure and weapons production sites as a first step towards full demilitarisation. And we have offered UK technical expertise to support this. Meanwhile, Israel must deliver on its commitments to withdraw. And third, we need the practical support and access that was promised for the Transitional Palestinian National Committee. There are still too many obstacles in its path, and it is still not operating within Gaza itself. That makes it easier for Hamas to retain its hold. We've offered practical support to the committee as they endeavour to fulfil their mandate, and we will lead international calls to support them in coordination with the Palestinian Authority, because Palestine should be run by Palestinians. Which brings me to the West Bank. Following to the ceasefire agreement, I warned that sustained peace would not be possible without a comparable effort to protect the viability of Palestinian statehood and rights in the West Bank. Instead, we have seen the opposite. Last week, a 7-month-old baby was killed in his mother's arms. His name was Sam Abu Haikal, after the IDF opened fire on a family car in South Hebron. And the UK supports the calls for an immediate and transparent investigation and robust accountability. Over the weekend, a gunman in Israel opened fire, with 1 killed and 5 injured, an attack that shockingly was applauded by Hamas. We've also seen rising and incredibly disturbing settler violence. Palestinian families and communities driven from their homes, brutally beaten while farming their own land. 950 violent incidents this year already. In April, settlers shot dead 2 Palestinians while attacking a school, and 1 was a boy of 14. Mr. Speaker, the UK condemns this shocking violence which terrorises Palestinians. Many Israelis are horrified at what they are seeing from settler extremists. The Netanyahu government has condemned some settler violence, but that rings hollow when there is scant accountability and when the agenda of the hardline settlers has now become intertwined with the approach of this Israeli cabinet. So let me set out today new action this government will take. First, I'm announcing a new wave of sanctions targeting the networks that are supporting this violence. Organisations including the Farms Association that fundraises for illegal outposts, strongholds for settler aggression. Ahavad Gilad that serves as the Farms Association's financial conduit. And Artsenu that has fundraised for military equipment for armed settler squads. This is the 4th package of sanctions under this Labour government against extremist Israeli settlers. We have targeted some of the most notorious individuals, the most significant settler entities, and the extremist figures in the Israeli cabinet who are inciting these acts. Today's measures mean the UK is second to none among international partners in targeting those facilitating and inciting settler violence. We're also going further. On the 22nd of May, the Prime Minister led a group of other world leaders warning businesses not to bid for construction tenders for E1 or other settlement developments. But this is not just about construction contracts. So today, alongside the Department for Business and Trade, I have strengthened our business risk guidance to make it clear and unambiguous. If you are a British citizen or business, you should not conduct any economic and financial activities in illegal Israeli settlements. And today, alongside my Right Honourable friend, the Culture Secretary, I have written to the Charity Commission for England and Wales, requesting that they open an investigation into evidence of UK charities that have links to illegal settlements. The Minister for the Middle East will meet with the Commission's CEO tomorrow, because no UK charity should be supporting or enabling these breaches of international law. The principles we're acting on, I believe, are widely supported across this House. We believe that settlements are a fundamental barrier to peace and a flagrant breach of international law. We believe that violent settler groups should not be profiting from the land that they have seized from Palestinians. And we also believe we must continue to distinguish and protect trade with people and businesses across the State of Israel, trade that reflects long-standing and important ties between our countries and communities. We will look to continue to coordinate our approach with close allies and look at further concrete steps to counter settlement expansion and promote peace and security. Finally, let me address our support for Palestinian governance. We are keeping up the pressure on the PA, the Palestinian Authority, to deliver its vital reform commitments on education, welfare payments and elections. We are expanding the direct practical help to the PA to reform and to deliver effective government for its people, drawing on the deep expertise of the UK Envoy for PA Governance, Lord Michael Barber. But the PA faces an enormous fiscal and healthcare crisis because the Israeli government has a stranglehold on the Palestinian economy, including withholding $5 billion of Palestinian tax revenue. That means schools and health facilities struggle to stay open for more than 1 or 2 days a week. An effective PA is directly in Israel's interest. It is both utterly wrong and incredibly short-sighted for the Netanyahu government to seek to undermine it at every turn. So the UK has stepped up our efforts in support. Alongside the support for reforms, this year we provided PA funding that helped 5,300 health workers sustain frontline services. And today I can announce we'll provide at least £10 million further to support the PA over 2026 to pay salaries, bolstering the PA's ability to function, helping dedicated health professionals to do their essential work across hospitals, clinics and maternity services. And our focus will be to build more effective, more democratic and more accountable governance, and to reinforce the unity of the West Bank, Gaza and East Jerusalem as inseparable pillars of the State of Palestine. International pressure and partnership on the ground have been vital over the last 12 months. And so later this week, I will travel to Paris along with other foreign ministers in advance of the Peacebuilding Conference, which is bringing together Israeli and Palestinian civil society groups alongside international partners dedicated to advancing the two-state solution. Because the momentum of last year must be reinvigorated for the sake of peace and security for all. I commend this statement to the House.
Dame Priti Patel, Shadow Foreign Secretary.
Mr. Speaker, Iran is the world's leading state sponsor of terrorism, and it's now over 100 days since this conflict began, and yet Iran continues to pose the most dangerous and significant threat to the Middle East, peace and security, and to the interests of Britain and our allies and friends in the region. In recent days, we have seen the most appalling Iranian attack in Kuwait, causing injury and death at Kuwait International Airport, and launched missiles towards Israel. They continue to obstruct the movement of goods through the Straits of Hormuz, seeking to hold us all to economic ransom. They refuse to end their nuclear weapons program. They carry on oppressing their citizens, having butchered thousands already this year. And they continue to sponsor and support terrorist proxies throughout the region, causing bloodshed from Lebanon to Yemen to Gaza. They've shown no interest at all in pursuing peace, and they laugh in the face of sanctions. No one in this House should have any shred of sympathy for the Iranian regime, which has caused so much terror and has blood on its hands. Iran has been the root cause of immense suffering in the Middle East for far too long, in places where it has no business whatsoever. And as the President of Lebanon has said in recent days, Lebanon is not Iran's country. Mr. Speaker, Madam Deputy Speaker, can the Foreign Secretary confirm whether British assets in the region were involved in any interception efforts over the weekend? And what does this latest attack mean for our defence posture in the region? It's all very well for the government to call on Iran to exercise restraint. That has never stopped them from carrying out the hostile attacks that just keep on increasing. So will there be any material consequences from Iran from Britain, like a new wave of sanctions to further up and ratchet the pressure? On these benches, we've been calling for new sanctions to prevent senior figures in the despotic Iranian regime, parking their wealth in London, and to ensure that Britain cannot be a sanctuary for enforcers of repression if those linked to the regime seek to flee Iran. So will the Foreign Secretary commit to taking both of these actions? And as I said in the House last week, Iran's terrorist proxy Hezbollah must be disarmed. It has caused immense suffering in both Lebanon and in Israel. We need to see UN Security Council Resolution 1701 implemented in full, and Hezbollah must comply. When I raised this in the House last week, the Minister for the Middle East said in response that it must be the Lebanese government to disarm Hezbollah, and he is absolutely right. But he didn't say what support Britain is actually giving to the Lebanese government now, because we all know that they cannot do this on their own. Is the government going beyond the traditional support Britain has offered the Lebanese armed forces and, for example, offering technical and intelligence assistance? The Foreign Secretary has said nothing in her statement on disarming Hezbollah, so can she tell the House today what the government is doing? And more broadly, Madam Deputy Speaker, we hope the ceasefires in the region can lead to a sustainable end to the conflict without a resumption in fighting. But clearly, we all know this remains incredibly precarious. Specifically on the Iran ceasefire, can the Foreign Secretary update the House on what involvement, if any, the government is having behind the scenes in mediation efforts? Has she personally seen the outline of the apparently close peace deal, or has had any input into it, and has she discussed this at all with Secretary Rubio? Madam Deputy Speaker, the Foreign Secretary has today announced a package of measures regarding the West Bank, Gaza and the 20-point peace plan. We all want to see an end to violence and conflict in the West Bank and in Gaza. And in particular, she's made very important points on aid and the fact that humanitarian aid and support is not getting through. Can she state what else the government has been doing to have critical discussions with the parties involved to see progress in this area? And can the Foreign Secretary tell the House what the changing guidance on change will actually trade will mean in practice and the practical efforts of these sanctions that have been announced today? She's mentioned asking the Charity Commission to investigate certain charities. Can she tell us what evidence she has that has prompted this particular request? And will she be asking the Charity Commission to investigate charities in the UK that are supporting Iran and terrorism? And on the Palestinian Authority, is the £10 million announced new money or from existing resources allocated? And can she give an update on the steps being taken to reform the PA and stop the pay-to-slay mechanisms? Madam Deputy Speaker, Iran is not alone and is backed by the authoritarian axis that we all speak about too much in this House. The Foreign Secretary has just been to one of those states, China, in the whole desperate attempt now for economic crumbs to bail out Labour's disastrous handling of the economy. The House is fully aware of China's role in supporting Iran, including providing offensive capabilities. The FCDO press release during her visit states that she stressed the urgency of reopening the Straits of Hormuz without tolls or charges, preventing nuclear proliferation in Iran and maintaining stability in the wider Middle East. But did China's foreign minister show any willingness to put pressure on Iran to reopen the Straits and to stop the illegal and reckless attacks that we are seeing? Did she raise with him concerns over China's enabling of Iran's offensive attacks? And there was no mention in the Foreign Secretary's statement or the press release from the Foreign Office of Jimmy Lai, which raises very significant questions for his family. Did the Foreign Secretary call for his immediate release and for an end to his politically motivated show trial? Did she threaten consequences if this did not happen? Finally, Madam Deputy Speaker, and without wanting to segue too far away from the Middle East, the Foreign Office also claims that the Foreign Secretary urged China to end its economic support of Russia's illegal invasion in Ukraine. But will any undertakings be forthcoming? China is a critical enabler of Putin's war, and we cannot simply turn a blind eye to this.
Foreign Secretary.
Thank you, Madam Deputy Speaker. So let me begin with the points that the Shadow Foreign Secretary raised on Iran. We agree, I think, on the dangers and risks from Iran. We've seen the threats and the strikes, that unprovoked strikes against the Gulf, against Gulf partners of ours, attacks on civilian infrastructure and energy infrastructure as well, and as well as the operations and attacks through proxies across the region, but also more widely, and including the attacks on Israel as well. That is why we have extensive sanctions against Iran. It's also why we have always been clear, under no circumstances must Iran be allowed to get or develop nuclear weapons. And it is why the UK, along with France and Germany, led the approach to the snapback restoration of sanctions against Iran in the autumn at the United Nations. We have also, because we recognise some of the threats from not just Iran, but also other state-backed organisations, including threats here in the UK. And that is why we have been working intensively, led by the Home Office, to draw up state threats legislation, which we hope will be able to pass swiftly through the House as well. She raised the issues around the business advice is about being very clear too, so there can be no doubt. This is not just about the construction of the E1 settlements, as raised by several government leaders, world leaders, to discourage any settlement, any involvement of businesses in the construction, but also more widely to be clear that the business advice is against any economic or financial activity in those illegal settlements, because they undermine the prospects for peace and security for Israel and Palestine alike. She returned to the issue about the Straits and the potential for an agreement. We desperately want to see an agreement take place. We are keeping in close touch with all of those involved, including with the mediators, as well as I have had many discussions with Secretary of State Rubio. We are not direct participants in the negotiations. That is directly for the US and Iran and the mediators, but we are doing anything that we can to support that process and to pursue as well a settlement that ensures not simply a partial opening of the Strait, but the full recognition of the principle of freedom of navigation and the underpinning of international law. And as a maritime trading nation, that principle is one that we should always be championing. And that is why I have directly raised that in China and in India, and specifically have been discussing with them the importance of maintaining that unconditional support for freedom of navigation. They have, both in the discussions, including in China, recognised the importance of no tolls on the Strait of Hormuz, and I have, of course, urged them to put any pressure they are able to put on Iran in order to comply and to come to this agreement. She raises Jimmy Lai. Yes, of course, I raised Jimmy Lai. We want to see him released urgently and have made that position very clear in this House, made the position very clear again with the Chinese authorities, and will continue to do so. And I will also be keeping close touch with Jimmy Lai's family on this as well, because we take the case so seriously. And then she also raised the issue around Russia and Ukraine. I have to be honest, we have a difference of view with China on this one. We have strongly been clear about the importance of our total solidarity with Ukraine, with its people, because ultimately Russia's threat to Ukraine's security is also a threat to Europe's security and is also a threat to the UK's security. And again, I have made those points very clearly to the Chinese government. And also as part of my visit, I've also raised those issues directly with the Indian government as well, who also take a different view to the UK on this crucial issue about Russia and Ukraine. But we will continue to make those points. And to be honest, I would say to her, I actually think it is really important as part of our security that we engage with the countries around the world, some of the biggest countries around the world, on those global security issues. And because this is not simply about economic or trading relationships, this is actually about our security. Our security is strengthened if we engage with, for example, China on these issues, whether it be on the Strait, whether it be on issues around Russia, Ukraine. And we do so in line with our principles, in line with our commitment to international law, and we will raise those differences and disagreements. But we also need to do so in the interests of our security and keeping people safe at home.
Chair of the Select Committee, Dame Emily Thornberry.
Thank you very much, Madam Deputy Speaker. I welcome the Foreign Secretary's statement, and I share the Government's condemnation of the illegal settlements that are systematically destroying any prospect of a Palestinian state. And of course, Madam Deputy Speaker, settlements don't build themselves. They require money and insurance and trade. So I welcome the changing guidance telling British citizens that they shouldn't conduct any economic or financial activity in the settlements. But the question really is, what happens if they do? Currently, the truth is that British companies are bankrolling annexations one settlement at a time. So surely, if the government can recognise that settlements are illegal, then why not just issue a ban on all trade in goods and services with the settlements rather than more guidance? Are we in danger of doing too little too late?
Secretary.
Well, we are clear that settlements are illegal and are undermining peace. We do not want trade with illegal settlements, and we want to deter support for those settlements, and that includes financial engagement and also includes the charitable organisations who should not be engaging as well. That is why we have set out new sanctions today and stronger business advice. Clearly, of course, we distinguish between illegal settlements and trade with businesses and organisations across Israel. And we will also continue to work with allies across the world on this. I recognise the points that my honourable friend has made, and I would say I know that countries who have looked at this have also found it hard to do some of these other further issues in practice, but we will continue to work with allies on what the practical arrangements are that can ensure that we stand up for international law and against these dangerous, these illegal settlements that are endangering peace.
Liberal Democrat spokesperson Callum Miller.
Thank you, Madam Deputy Speaker, and to the Foreign Secretary for advance sight of her statement. The steps announced by the Government today are important and right. British businesses and charities have to know that engaging with or sustaining settlements in the West Bank is illegal and unacceptable. So the updated business risk guidance is correct, but it is overdue. The Dutch government issued a similar discouragement notice in 2006, 20 years ago. It is also insufficient. The government should have used this moment to set out specific sanctions on British firms which enable or finance the expansion of illegal Israeli settlements. So will the government move to review sanctions much more regularly and bring new packages to this House every month? And will the Foreign Secretary finally heed Liberal Democrat calls to ban all trade in goods and services with the illegal settlements? Madam Deputy Speaker, last September, this government took the historic decision to recognise the State of Palestine. That was the right thing to do, and a step which Liberal Democrats have been advocating for almost a decade. But the Israeli Security Cabinet is moving fast to expand legal rights for land purchases in the West Bank, while settler violence towards Palestinians continues. The UK's complicity in enabling the growth of illegal settlements runs deep. This Sunday, the Great Israeli Real Estate event is coming to London. Properties in illegal settlements in Gush Etzion are being marketed alongside properties in Israeli cities. This is Palestinian land being advertised, bartered, and sold on the streets of our capital. So will the government intervene to ban the event unless assurances can be made that no properties in illegal settlements will be advertised? Madam Deputy Speaker, turning back to the wider region, Hezbollah has continued to strike northern Israel, but the latest exchange of fire between Israel and Iran following Israeli strikes on Beirut shows just how precarious the regional ceasefire is. Talks towards a peace settlement cannot be derailed. So does the Foreign Secretary agree that IDF actions in Lebanon directed by Netanyahu are materially undermining the chances for reaching a wider peace settlement? And what actions are the government taking to address this? Finally, Liberal Democrats have long called for the prescription in the UK of the IRGC. The government has now committed to legislate this session. So will the government engage across the House to see whether this law can be brought forward immediately and fast-tracked into legislation?
Foreign Secretary.
Can I thank the honourable member for his comments, including on the importance of the recognition of the state of Palestine. And we should always be clear that there is no alternative to a two-state solution in terms of establishing any peace and security in the region. And that is why it is crucial that we work to maintain the prospects of a two-state solution now. He refers to the sanctions regimes, and we are looking not just to continue to increase sanctions and targeted ones, but also at potential ways to strengthen the overall sanctions regime as well. What I would say to him is we have been one of the leading countries in the world on sanctions around the illegal settlements. He will know we were one of the few countries who have actually sanctioned individual Israeli cabinet ministers who have been inciting the extremist behaviour and settlements, and where, of course, we saw one of those cabinet ministers in the most shameful behaviour around the Gaza flotilla in recent weeks as well, and the treatment of people there. He raised the issue more widely about going further in terms of the trade issues. Again, I would say what I said to my honourable friend. We have been very clear. We do not believe there should be trade with the illegal settlements. We have been clear and extremely strong in the advice that we are giving, and we will continue to work with allies across the world on the most effective way to maintain this. It is also important that we differentiate between illegal settlements and between the trade with businesses and organisations across Europe. On the issues around the threats, obviously, from Hezbollah, it is devastating to the people of Lebanon who have seen Hezbollah as an Iran-backed proxy hijack their chances of peace. But we have also, including my honourable friend, the Middle East Minister, has raised in this House as well, our deep concern about the Israeli escalation in Lebanon and the dangerous impact of that on the Lebanese people as well. We want to see the settlement between
Deputy Speaker, I welcome the Foreign Secretary's statement and the measures that she has announced today. But I want to come back to part of the announcement from the Foreign Secretary where she gives strong advice to businesses that we should not conduct any economic and financial activities in illegal Israeli settlements rather than an outright ban. We know a ban is possible because we did it for illegally occupied territories in Crimea and Ukraine. And we know it's the right thing to do because when it comes to trading in ivory, firearms or narcotics, we ban it outright. And we know that anything less than a total ban risks the UK aiding Israel's repeated violations of international law. So isn't it time to move beyond strong guidance and advice and actually take meaningful action and proportionate action and have an outright ban?
Well, look, I think we share the view that the settlements are illegal, that they undermine peace, and that we want to prevent trade with illegal settlements and discourage anyone, including UK businesses, but actually from around the world, from supporting those settlements. And that is why we're using our sanctions regime exactly to target some of the issues around the settlements, and also why we are looking at other ways to be able to strengthen our sanctions regime as well. We will continue to work with allies across the world on this. There are other countries who have also looked at these issues and what more can be done, and found that some of the practicalities are complex in this area, but we will continue to work with allies.
Richard Ford.
Madam Deputy Speaker, President Trump spoke to the BBC yesterday and said his relationship with Prime Minister Netanyahu was such that, quote, if I tell him to do something, he does it. It's all very well for the British government to contingency plan, such as with the multinational planning conference that we saw at the end of April at PGHQ Northwood. But this will be mere displacement activity if there is no peace deal. What is the Foreign Secretary doing to encourage Washington to demand restraint from Tel Aviv in Lebanon to help bring about a peace deal and an end to the blockade of the Strait of Hormuz?
Foreign Secretary.
So I can tell the honourable member that we have continual discussions with the US Secretary of State. We have continual engagement with the US administration on the support for reaching a peace settlement. That also includes the reopening of the Strait of Hormuz fully and unconditionally, and of course preventing Iran getting a settlement. We have also discussed with the US the importance of the ceasefire in Lebanon and not allowing what is happening in Lebanon to destabilise the wider peace agreement. I've explicitly had those discussions with the US administration, and I think it is noticeable that the US brokered the ceasefire in Lebanon, which is not, which continues to be violated, but is essential that that ceasefire is respected and holds in order to make it possible to also get the wider settlement in place. And in terms of the multinational maritime mission, that is explicitly in order to be able to help restore global shipping as rapidly as possible. It's not a substitute for a peace settlement. Of course, we need to get the settlement in place and commitments to the reopening of the Strait, but then we need the practical measures, including reassurance to shipping and demining, to make sure it opens as well.
Yasmin Qureshi.
Thank you, Madam Deputy Speaker. Israeli ministers have reconfirmed what we've all known, the intention to settle Jewish settlers in southern Lebanon, as they've done in West Bank and are doing so in Gaza. And with the E1 project, will bury the idea of Palestinian state forever. This is something many of us known for a long time. And we are seeing in real time ethnic cleansing and war crimes being committed, all part of the greater Israel project. And this Sunday, there is a real estate event openly selling land in the illegal West Bank settlement on UK soil. It is really sad that the Shadow Foreign Secretary, who in her response talked a lot about Iran, but could not bring a word of sympathy for the plight of the Palestinian people. Can I therefore ask the Secretary of State, can we please put an outright ban on trade, stop selling arms to Israel, and strengthen the International ICJ, as their judges are routinely being threatened by the US administration?
Well, what I would say to my honourable friend is she will know that this government, in fact, my right honourable friend, brought in new restrictions on arms sales to Israel exactly because of the concerns that we had about ensuring that we will always stand up for international law. And we have also set out, we've been one of the leading countries right across the world in terms of introducing sanctions, including on individual Israeli government ministers as well. She referred to some of the concerns about settlements and expanding illegal settlements, and I agree with her about the dangers of the E1 project, which is clearly illegal and damaging to peace. I have to say I am also troubled about some of the comments that we have heard, including from Prime Minister Netanyahu around Gaza as well, and the potential discussions and comments about Israel trying to take over 70% of Gaza and having a permanent divide in Gaza as well. That would be fundamentally flouting and overturning the 20-point plan, which Israel signed up to alongside Hamas, alongside countries across the world. It is vital that they respect the 20-point plan and withdraw as part of the agreement from Gaza, and that is why we want the international effort and energy restored to implementing the 20-point plan.
Sir Desmond Swain.
Clinging to life in Gaza and scratching an existence in the West Bank merely occupy different circles within the depths of the inferno. Any relief is dependent upon the policy of Israel, and that in turn would require pressure from its principal ally, the United States of America. What is the Secretary of State's estimate that there is any prospect of that?
Foreign Secretary.
Well, we do need Israel to lift restrictions on the humanitarian aid to Gaza. It is just horrifying that we have families going without food that they desperately need and medical support that they desperately need. I have discussed this many times, including with the US administration, as well as, of course, directly with Israel as well. And I think at the beginning, immediately after the 20-point plan, there was an increase in aid as a result of the international commitment. But since the start of this year, that has plummeted again. And that is why I believe we need that international energy restored behind the 20-point plan and behind the commitments that were made as part of it to get aid back in.
Andy MacDonald.
Thank you, Madam Deputy Speaker. I thank the Foreign Secretary for her statement. And I want to thank the Minister as well for he agreed with me last week when I referred to the forced displacement of people by Israel as a war crime. I'm grateful for that. I also want to commend the Honourable Member for Cowdenbeath and Kirkcaldy for the sterling work she's done in regard to raising the issue of charities, and that's reflected in the statement. But can I press the Foreign Secretary, because she talks about the businesses should not conduct any economic or financial activities in illegal Israeli settlements. Well, there's got to be consequences for that. Those activities are criminal. And we have the architecture in this country around the sanctions and anti-money laundering legislation and the Proceeds of Crime Act. So can I ask the Foreign Secretary, what conversations is she having to ensure that the Solicitors Regulation Authority, the Financial Conduct Authority are giving guidance to their members, but importantly, the National Crime Agency? Because until such times as those companies are prosecuted, convicted for their crimes, I'm afraid this is not going to bite.
Foreign Secretary.
So we have clearly strengthened and set out the stronger business advice, but also we are strengthening our sanctions regime to directly target those organisations, including international organisations, that are deliberately facilitating, funneling resources to some of the illegal settlements where we have seen some of the really disturbing settler violence take place. We are looking at ways to strengthen the sanctions regime that we have, and we will continue to go further in setting out new sanctions and pursuing sanctions enforcement as well. And we will also continue to work with allies across the world on this, because I think this is an issue where no one country can do this alone, where we do have action that we have been leading across the world, but given the scale of some of this trade is actually very often about international, then the more that we can build international consensus around this, the more impact we can have.
Ayub Khan.
Thank you, Madam Deputy Speaker. I don't seek to offend the Foreign Minister, but how can we lecture businesses within the United Kingdom about morality when we are witnessing a genocide? And this government, even when you consider a risk of a genocide, should take steps to prevent that, such as cutting off all trade, and we still supply components to the F-35 programme. We've witnessed 5 British citizens being tortured and sexually assaulted and dumped in Greece recently. A 7-month-old child murdered in the hands of his mother. No doubt an investigation will probably conclude that that child was a shield. So I ask the Foreign Minister, why not sanction the leader, the Prime Minister Netanyahu? And what will this government do to prevent this show business in London on Sunday, selling illegal properties here?
Yeah.
Well, as I have said to my honourable friend, we will pursue any angle that we can around operations that are taking place here in the UK. I think it is important to be clear, we have very much led the way in terms of the sanctions that we impose. Most countries obviously do not sanction individual members of the Israeli government. We have done so because we were so appalled by the incitement from those individuals, and one of those ministers, as he will know, was involved in the shocking, flaunting and just the most sort of disgraceful promoting what were clearly real disturbing ways of treating human beings that didn't meet the basic standards of humanity on the flotilla. But of course he also referred to the case that I described in my statement, where it was really distressing case of just a 7-month-old baby being killed as well. So that is why we will continue to pursue issues around sanctions. We will continue to pursue other options with allies across the world. But I do think the other thing that we will need is to build that same sense of international consensus that we had in the autumn around the 20-point plan for Gaza. It only partially covered a consensus around the West Bank at that time. We and other countries did obviously recognise the state of Palestine
Palestine as part of that, and so there was that strong commitment, and part of the 20-point plan does refer to the transition to the Palestinian Authority and the links with the future state of Palestine. But what we need is to strengthen that international consensus that was built in the autumn much more widely to cover not just Gaza, but also the West Bank and also a broader regional security framework as well. We've seen the power that you can have when you get that international consensus together, but individuals, countries acting alone don't have that impact.
Andrew Pakes.
Thank you, Madam Deputy Speaker, and I welcome the dedication and commitment of the Foreign Secretary and my right honourable friend, the Minister, for trying to advance this issue in line with the will of this House. Only too sadly, it is no surprise to many of us that whilst the eyes of the world have been largely focused on Iran, we've seen abuses continue and get worse within Gaza and the West Bank. Yep. It is a deliberate strategy of the Israeli government. We talk often about settler violence. This is state-supported settler violence. It is not the acts of individuals alone. So I welcome the advanced package we have put forward today, the move for the Charity Commission, but also moving from individuals to groups in terms of our sanctions. But this isn't just about aid coming in, it is also about justice. Justice for Palestinians, justice for the West Bank, and building a wider peace. Can I ask the Foreign Secretary what judgment we will make about whether the sanctions go far enough, when she will come back to the House and tell us whether we go further? And if she agrees with me, this is a cause for justice, and it's a cause for justice that time needs to be taken more seriously.
Foreign Secretary.
I do agree with my honourable friend, and effectively what is going on, we have seen talk of annexation of parts of the West Bank, and that this is not simply about a small rogue group that are going against the intentions of the Israeli government. The E1 settlement has been authorised by the Israeli government and promoted by the Israeli government. And yet it is illegal. It goes against any prospects for peace and security in the region, and frankly is damaging ultimately for the security of Israel, as well as for peace, security and justice for the people of Palestine. So that is why we will continue to pursue this. But I do think we have to combine two things. We have to combine what we can do in terms of our own sanctions regime and working with our closest allies on those sorts of measures and putting pressure on. But we also need to promote that wider international consensus and energy. We had it briefly in the autumn, but it had built up over many months. We've got to rebuild that now.
Sir Julian Lewis.
Does the Foreign Secretary accept that repeatedly saying that a terrorist group must do something doesn't make it happen? So when she says that Hezbollah must end its dangerous attacks and disarm, does she expect this to happen voluntarily? And if not, how does she expect it to be brought about?
Foreign Secretary.
The Hezbollah is a dangerous terrorist organisation. It is undermining security for the people of Lebanon. We support the Lebanese government and the Lebanese armed forces in taking action against Hezbollah, and we are providing them with direct support, including with funding and capability support as well, because we believe that they should be able to do this with international support as well. It is hugely important. We also think, frankly, that Iran should be putting pressure on its proxies rather than using proxies to escalate tensions and to escalate activity. And so we are also putting pressure on Iran to also put pressure on Hezbollah as well.
Imran Hussain.
Thank you very much, Madam Deputy Speaker. Frankly, the measures announced today, whilst necessary, do not go nowhere near far enough. They will not stop the genocide in Gaza, they will not stop the war crimes in Gaza, and they certainly will not stop the continuation of illegal settlements. So I say to the Home Secretary, the Foreign Secretary, what real concrete measures can she announce here today? She stated earlier to a number of colleagues who asked the question that she wants to see an end to trade with illegal settlements. Well, that's in her gift, because she can stand on that dispatch box today and announce a ban on trade with all illegal settlements. Why will she not do that?
So, as I would say to my honourable friend, is that we are announcing these sanctions which go further than ever before in targeting the organisations that are effectively facilitating, promoting, encouraging and developing these illegal settlements. And we want to continue to go further on the sanctions and also in looking at ways to strengthen our sanctions regime so that we can also go further to put additional pressure on. But I think, look, what I would say to him on this is, look, individual countries can take particular action around things like sanctions in different ways, those trade issues that we have discussed and so on as well. But actually, the biggest impact is going to be building an international coalition and consensus on this. That is what happened in the autumn around Gaza. That has now been lost or has been reduced since then. We have to rebuild that again, but we have to this time make sure it includes the West Bank as well as Gaza.
Anna Sabine.
Much, Madam Deputy Speaker. I was recently on a cross-party visit to Israel and Palestine, and we met with the Norwegian Refugee Council and talked about the issue of dual-use items, which is where the Israeli government doesn't let certain items into Gaza if it argues they can be used for terrorist purposes. This includes situations where young children are able to leave Gaza to get hearing implants in countries like Jordan and are then not allowed back into Gaza because the component parts are considered dual-use items. Can I ask what pressure the government can bring to bear on the Israeli government to prevent the weaponisation of this issue against the Gazan people?
Foreign Secretary.
We have raised exactly this issue many times, directly with the Israeli government, also with the CMCC, the coordinating committee, and with the US administration as well, because she is completely right. And we're ending up with basic medical equipment being turned down because somehow it could be treated as dual use, or tent poles for basic shelter being turned down because somehow it could be dual use. This is deeply damaging, and it's also, these are different standards to the ones that applied even 12 months ago. Even when there were previous ceasefires, we managed to get a lot more aid through and a lot more support through than have been now. And that is why it is crucial that aid is not weaponised. It is a basic human right, and we will continue to strongly argue for an increase in humanitarian aid.
Melanie Ward.
Thank you, Madam Deputy Speaker. I welcome the new package of sanctions that the Foreign Secretary has announced today. They are important. And as I raised with government ministers last week and discussed with the Foreign Secretary last night, last week I submitted a formal complaint to the Charity Commission about 32 UK charities which over the last 5 years have funnelled some £28 million to illegal Israeli settlements. The research into this was conducted jointly with Israeli human rights organisations. They include UK Toromet, which currently has a live donation page to Art Zenu, which the Foreign Secretary has just announced sanctions against. I welcome the fact that she has raised this with the Charity Commission. I would say that they were made aware of these issues in July 2025 and have done nothing so far. Can she be clear that we're not just looking for an investigation but a ban on this? And in reference to the letter that myself and 140 other Labour colleagues sent her this week about a ban on trade with Israeli settlements, can she also now say that we will look to move towards a ban on top of the guidance that she's issued?
Foreign Secretary.
Well, can I welcome the work that my honourable friend has done on the abuse of charity systems to funnel support to illegal settlements. She, I think, has rightly raised this, not just with me, but also with the Culture Secretary. She's raised this directly with the Charities Commission. I can tell her that my honourable friend, the Middle East Minister, will be meeting with the Charities Commission CEO tomorrow in order to be able to pursue exactly this issue, to ensure that there is a thorough investigation, but also some of the evidence suggests that rules are being broken. We should not be having UK gift aid
end up being funneled to illegal settlements. That is clearly breaches all kind of standards that anybody across the UK would expect, and also the Charity Commission rules as well. So that is why it's essential that this is looked at. And on the wider issues around trade, we don't want trade with illegal settlements, and that is why we're going to continue to look at strengthening the sanctions and strengthening the sanctions regime and continuing to work with allies across the world.
Brendan O'Hara.
Thank you, Madam Deputy Speaker. While we welcome these new sanctions, the issue of the illegality goes much deeper than these now sanctioned organisations. The illegal settlements in the West Bank are state-sponsored, they're state-financed and they're state-protected, and which is also the case for the settler violence, which inevitably follows and is carried out with almost a complete impunity. So why has the government chosen to sanction these particular organisations, but has decided not to take further action against the Netanyahu regime in the face of what is state-sponsored illegal settlement policy?
Secretary.
Well, as I set out earlier, the UK has introduced sanctions against individual members of the Netanyahu government, something that actually very few countries across the world have done, but we believe it is the right thing to do because of the seriousness of what they have done and the seriousness of the situation around the illegal settlements. He is also right that this is about international law more widely, but also specifically it's about the peace and security of the Middle East, where we know that there is no alternative to the two-state solution, but ultimately to make progress, as we did for a brief period in the autumn around Gaza, we need to build that international consensus up as well, and not just look for what individual countries should do.
Richard Bergen.
Thank you, Madam Deputy Speaker. Let's just imagine if this weekend in our capital city there were a great Russian real estate event selling off Ukrainian land. Quite rightly, without hesitation, the government would move to ban such an illegal event. This weekend in London, there is the Great Israeli Real Estate Event, openly advertising the illegal sale of land in illegally occupied Palestinian territories. The government has rightly recognised the state of Palestine. Surely, given that, we should now move to ban this event, selling off land illegally in Palestine in our capital city this weekend.
Foreign Secretary.
Well, we are pursuing this particular event, and also if there are any cases where we find that there are breaches of UK law, we will also pursue those issues as well. But look, there is a wider issue here, which is that nobody should be advertising in the UK illegal settlements. Nobody should be pursuing those illegal settlements. No businesses, no organisations should be getting involved in them. And we have shown our willingness and determination to impose sanctions on organisations that do, just as we have set out today. We will continue to do further sanctions where we have the opportunity to do so, because support for illegal settlements is wrong.
Kit Malthouse.
Madam Deputy Speaker, one of the most depressing things about these statements is the profound damage that they do to the British national interest and our standing in the world through their pathetic delusion. On Gaza, could she please confirm that she's aware that just in the last 2 weeks, Israeli ministers have made clear their desire for mass emigration of Palestinians from the territory, and that we should see the stranglehold they've imposed on the territory in that context? And secondly, on sanctions, could she also confirm that the sanctions, the meagre sanctions that the government's imposed so far, both governments have imposed so far, have had absolutely no impact on the conduct of anybody in Israel, let alone the Israeli government, and that this current wave of what she's calling sanctions are not actually sanctions. They're asset freezes, which means that unless these organisations or individuals have assets in the UK, they will have no impact. And in fact, the regime she's chosen to bring them in under does not even include goods and services. So we're all still free to sell them bricks and mortar and corrugated iron and insurance,
and so they're unlikely to have any impact whatsoever on what's going on in the West Bank.
Foreign Secretary.
I'll just say to the honourable member, we've been clear that having an impact on what happens in Gaza and the West Bank depends on building international consensus, but also depends on taking multiple actions. And he wants to stand there and complain about what the government has done. Just consider for a second the things that this government has done that his government previously refused to do. We have restored and increased funding to UNRWA. We have suspended arms licences for use in Gaza. We have dropped the challenge to the ICC jurisdiction. We have suspended trade negotiations with this Israeli government. We have introduced 4 packages of sanctions on violent settlers, including sanctioning Ministers Smotrich and Ben-Gvir, leading the first group of countries in the world to do so. We have led diplomatic efforts at the UN, launched a Medivac scheme for sick Gaza children and their families, helping to get students into the UK. We have supported UK field hospitals in Gaza, treating hundreds and thousands of Gazans. We are funding mine clearance operations and providing more than £129 million in humanitarian assistance this year, and then protecting that each year of the spending review. And most importantly of all, we took the historic decision that his government for years refused to take to recognise the state of Palestine as part of the inviolable right of the Palestinian people. I think that was the right thing to do.
Rachel Maskell.
Thank you, Madam Deputy Speaker, and I thank the Foreign Secretary for her statement. We know that over 20,000 children have been killed in Gaza. 21 have had life-changing injuries, and we made a commitment for those that will bring around 300 children to the UK to have urgent surgery to aid them on their way. Last week, I met with 2 of those children. They had a specific plea. First of all, that we expand that scheme and bring those children over. 4,000 children are waiting, and they need our medical care. But secondly, they only can bring one parent. They want both their parents to be with them. Having their family around them will help with their healing. Can we ensure that their families can come too, to ensure that those children are safe, mentally as well as physically, as they get the support they need?
Can I thank the honourable member, including for her representations around the Medivac scheme, which I've strongly supported. I have personally looked at cases where children have been able to bring more family members than that. So if she has individual cases, do by all means raise them. But it's certainly been, I know there are many cases where the children have come with both parents from Gaza. We will make further announcements in due course around the Medivac scheme. But I think we also have to make sure, because there are also many children who may not have the most life-threatening of conditions, but may desperately need some kind of medical treatment and support that they are not getting in Gaza. And that actually one of the greatest priorities is being able to rebuild healthcare facilities in Gaza to treat as many children as possible.
Jeremy Corbyn.
Thank you, Madam Deputy Speaker. At the moment, Palestinian people are only allowed to occupy 40% of the Gaza Strip, and that figure is going to go down to 30% next month if Netanyahu has his way. Israel is bombarding, through settlers and their own violence, the people of the West Bank, and Israel is now occupying a large part of southern Lebanon. I think the House needs to know exactly what is the nature of a security relationship between Britain and Israel, what information is shared, what weapons are supplied, and why are we still supplying parts for F-35 jets, knowing full well that those planes are used as acts of genocide against the Palestinian people.
Yeah.
Well, I can say to him we will know that we introduced, after the election, new strong arms export controls to cover any operations and anything that could be used in Gaza, and including anything that might breach international law, and we have been very clear about that. But he raises the issue about the yellow line in Gaza. I am deeply troubled about this. We have heard Prime Minister Netanyahu talk
talking about trying to seek 70% control of Gaza, when in fact the 20-point plan involved full withdrawal from Gaza as part of that 20-point plan. And I am very worried that there are attempts underway to try and make that yellow line permanent and to condense the land available for the Palestinian people in Gaza to be an ever smaller area within Gaza. That goes fundamentally against the agreements in the 20-point plan that were endorsed by Hamas, by Israel and by countries right across the world. And it is that 20-point plan that needs to be upheld, and that does include the withdrawal of the IDF from Gaza as part of the implementation of that plan.
Paula Barker.
Thank you, Madam Deputy Speaker, and I'd like to thank the Foreign Secretary for her statement and confirming that she's strengthened our business risk guidance to make it more clear and unambiguous. But to labour the point that the Honourable Member for Sheffield Central stated, we know settlements are illegal. So why is the government only publishing guidance to businesses? Because we don't simply issue guidance to stop businesses trading in ivory, in illegal firearms or narcotics. We ban them, as we have banned businesses from trading with illegally occupied Crimea. The Foreign Secretary stated that it is complex. So why is the guidance enough when it comes to illegally occupied Palestinian land, but not illegally occupied Ukrainian land? Can the Foreign Secretary be clear and unambiguous in her response, please?
So we are clear as part of what we are doing with this package of additional sanctions that we are targeting businesses and organisations that are facilitating the operations in the illegal settlements. We believe that the sanctions regime needs to be strengthened to allow us to go further in different areas, and we also think that we need to work with other countries on this. This is an area where other countries there is obviously important to be able to distinguish between what is happening in the illegal settlements and trade with Israel and right across Israel. So there's a specific issue we are targeting about settlement goods and Israel and the illegal Israeli settlements. Other countries have been looking at this and have found some of the practicalities challenging. So I understand the point that she has made, and I understand the concerns being raised around this. All I would say to her is we continue to look at all of these issues, what more can be done, and continue to work with international partners.
Dr. Andrew Murison.
Madam Deputy Speaker, can the Foreign Secretary explain the multi-bit of the multilateral maritime mission? Because so far all I'm seeing is France and the UK, and in particular she said that she had spoken to her interlocutors last week in China and India. Well, one's a permanent member of the UN Security Council, another's a member of the G20, and both of them stand to suffer far more than the UK does and France does from a cessation of oil and gas and fertiliser. What assets will they be providing to this multinational maritime mission?
So China and India are not part of the multilateral maritime mission. We have been doing two things to maintain the principles around freedom of navigation. We've been developing with France the multilateral mission. There are other countries that are ready to provide assets, some of which have been set out, some of which will be announced in due course as they are needed. But we have also convened countries together, including 40 countries that I convened before Easter to pull together to raise the consensus around the principles of freedom of navigation and to continue to defend those. The Chinese ambassador did also attend a similar event in Paris, chaired by President Macron and the Prime Minister on that. So we are engaging with those countries on the principles of freedom of navigation, but the maritime mission is a much narrower group of countries, predominantly but not entirely European.
Bel Ribiera Rade.
Thank you, Madam Deputy Speaker. Once again, British citizens taking part in the Global Smooth Flotilla, a peaceful aid mission to break the illegal blockade of Gaza, have been severely mistreated by the Israeli government, and this is beyond dispute, with video evidence of a far-right Israeli minister mocking activists while they are bound and on their knees, something the Foreign Secretary made reference to earlier. The Italian government has opened an investigation, and the EU is expected to vote next Monday on sanctions. I'm sure the Foreign Secretary agrees that British nationals deserve the same protections and robust response. So can she confirm her earlier response that the offending minister remains under sanctions, and what further actions will be taken specifically to stand up for these British citizens?
Like my honourable friend, I was appalled to see the video of the way in which people were being treated. It did not meet the most basic standards of humanity and respect for other human beings. And it was particularly shocking that not only was that mistreatment happening, but it was being promoted and flaunted by an Israeli government minister. I can confirm to her that the Minister Ben-Gvir is sanctioned by the UK government. We've been one of the first countries to sanction him, and we will continue to sanction him. And that video evidence, that behaviour, as well as some of the other things that he has continued to do and say, just show and provide the clear justification as to why we are right to do so.
Andrew George.
Madam Deputy Speaker, apart from the Netanyahu fan club on the Tory front bench, most honourable and right honourable members condemn the appalling and murderous actions of that far-right regime. But does the Foreign Secretary not recognise that Netanyahu is laughing behind his hands as Israel easily bypasses the flimsy trade and arms sanctions which the UK government has presented them with? And she talks about introducing or building an international consensus. I mean, is it not time to ensure that we take stronger action and, building that consensus, propose the introduction of peacekeepers into Gaza, international peacekeepers into Gaza, to ensure the peace, to stop the bloodshed and to get the humanitarian aid in?
Foreign Secretary.
Well, the honourable member will know that as part of the 20-point plan included an international security force, international stabilisation force that was effectively about bringing peacekeepers into Gaza. That has not yet happened. And I think some of the reasons for that is because there simply has not been enough progress. And the areas I think there hasn't been enough progress, as well as the humanitarian aid, which I just think is basic. We've also not, we have promoted the argument that some of the decommissioning for Hamas weapons needs to reflect, for example, some of the experience around Northern Ireland. Some of these things are not simple processes, but you need to get them started. It's essential to get that started. But we also need a practical approach to allowing the Palestinian Committee to operate, to start operating in Gaza, to being able to provide the support and training for Palestinian police to be able to operate within Gaza. So to get some of those security conditions right so that you can bring in the ISF, where other countries have said they would be willing to do so. But getting to that point requires more commitment and energy, particularly from the Israeli government, but also more broadly as part of the 20-point plan, so that we can reach the point that he suggests.
Rachel Hopkins.
Thank you, Madam Deputy Speaker. And I welcome the Foreign Secretary's statement today and the fourth package of sanctions against those groups supporting the extremist Israeli settlers, and the strength and guidance that no businesses, UK businesses, should have any financial or economic links with illegal settlements, although many of my constituents would want to see an outright ban because they are seeing a continued expansion of illegal settlements. And even just last week, the announcements by Minister Smotrich of over 2,000 new homes, in and around Jerusalem, Nablus and Hebron. So does my honourable friend agree with me that this is an absolute violation of international law and goes nowhere to securing a lasting peace between Israel and Palestine?
Well, the expansion of the illegal settlements is not only deeply wrong because this is Palestinians' land that they are being forced out of, sometimes in the most brutal of circumstances. It is also, look, it is designed. We know that some people are deliberately designing this in order to try to make it impossible to ever get to a two-state solution. That is the purpose for some of those involved in this, and we should be very clear and call that out for what it is. And that is why it is so important to strengthen the condemnation of the illegal settlements and the expansions, but also to be clear that we cannot stand back and allow effectively what could become an annexation as well. And that needs to be linked to the 20-point plan, because my point has always been we will not sustain the ceasefire that was rightly brokered by the US in the autumn. We will not sustain the ceasefire in Gaza, and we will not achieve peace and security for Palestine and Israel if we end up with such devastating consequences for the West Bank, and if we do not have a track to get to a two-state solution.
Dr. Ali Chowns.
Thank you, Madam Deputy Speaker. In the face of consistent, sustained and systematic war crimes, violations, abuses by the Israeli government, the Secretary of State has today announced further piecemeal sanctions and guidance. This goes nowhere close to acknowledging the reality that the most important sponsor, financer, protector, supporter, cheerleader of that illegal settlement expansion is the Israeli state itself. Sanctioning a few organisations ignores the reality of where the power lies in this situation. Is it not long past time for this government, which says it is concerned about this issue, to use all of its limited power, influence, leverage to take action against the Israeli state itself, starting with Netanyahu, with genuine, full comprehensive sanctions and a full ban on any engagement with settlements?
Well, it is exactly because we are so deeply concerned about the expansion of illegal settlements in the West Bank, and also the humanitarian crisis continuing in Gaza, and the responsibility of the Israeli government to uphold the 20-point plan, which is not happening at the moment in Gaza, and to withdraw from the illegal settlements in the West Bank, and to lift its chokehold on the Palestinian Authority. That we have taken action, including sanctions and including leading the way internationally. We are one of the few countries in the world to sanction individual Israeli government ministers, including for the way in which they have argued for incitement and the way in which they have effectively encouraged the expansion of these settlements. So we are going right to the heart of the Israeli government with the response that we have taken, alongside other measures, including support for the PA, including financial support, including development support for the Palestinian Authority, and including recognising the Palestinian state for the first time, which was historically the right thing to do. But the other thing we need to do, if we are to deliver results, is we have to build international consensus. That is what delivered the 20-point plan in the autumn, was that international leadership and international action. And that is what we will do again as part of the peace-building conference in Paris this week.
Members will have noticed that this statement has been going on quite some time. So if I could ask members to keep their questions short and the Foreign Secretary to keep her answers shorter. Mohammed Yazin.
Thank you very much, Madam Deputy Speaker. Earlier this month, an Israeli soldier shot dead 7-month-old baby Sam Ahafad Abu Haikal and wounded his parents in the occupied West Bank. Far from being an accident, UNICEF reports that violence against Palestinian children has reached levels not seen in decades. Given the difficulty of even Israel's closest ally, the United States, to restrain Netanyahu's actions across the Middle East, when will the government bring in stronger measures, including sanctions, and do more to ensure those committing war crimes face accountability under international law?
My honourable friend has rightly raised the very deeply distressing case of a 7-month-old baby killed in his mother's arms, as I mentioned in the statement at the beginning. And he is also right to highlight the number of Palestinian children who have lost their lives as a result as well. And the problem is that if even where there has been either investigation or condemnation by the Israeli government, very often there is a complete lack of accountability and impunity. It is vital that where there are issues like this and cases like this, there is proper investigation and accountability too.
Mark Pritchard.
Lebanon, the Shia community, as I mentioned to the Middle East Minister last week, not all of them in Lebanon support Hezbollah, don't support Iran, and many, the majority, don't support violence. They want to live in peace like all of us, whatever country we're in. So on the question of the Amal movement, which is a Shia political movement, as the Foreign Secretary will know, whilst it's not a benign movement, it's certainly, in comparison to Hezbollah, probably a better interlocutor, subject to conditions, to work with in rebuilding the whole nation of Lebanon, which of course will include the important Shiite community. So I'd be interested, what more can the government do to increase capacity building of political parties and movements that want to move away from armed violence and struggle?
Well, the honourable member is right that we need an inclusive process in Lebanon that brings all groups and communities together but excludes Hezbollah, excludes Iranian-backed proxies and includes terrorist and extremist groups. The group that he raised, I know, is led by Speaker Berry, who met my honourable friend, the Minister for the Middle East, as part of his recent visit, and we will continue to engage with them and also to engage more widely with the Lebanese government about the importance of bringing all communities together so that Lebanese people are not exploited by Iran.
Apsana Begum.
A prohibition must be brought in to finally deal with British firms such as JCB, which has for decades been involved in settlement construction and the demolition of Palestinian homes. The Secretary of State has not confirmed why a full ban on settlement goods has not been brought. When she says that the practicalities are too complex, the British public only see a government dragging its heels. So can she clarify what these practicalities are? And once again, why is it possible to have a full ban for occupied Crimea but not for the occupied West Bank?
Well, I would say to my honourable friend, we have introduced today new and strong sanctions against organisations that are operating, fuelling funds or trading in the illegal settlements. We do have different sanctions regimes, including different geographic sanctions regimes and different thematic sanctions regimes. We believe that the sanctions regimes need to be strengthened. And we are looking at ways to do that give us more flexibility to respond to different circumstances. Obviously, in the case of the what is happening in Israel and the occupied Palestinian territories, we want to be able to target the illegal settlements and the trade and activity there, but we do not want to impact on trade that runs all across Israel, long-standing trade with organisations and businesses and links between communities that have always operated right across Israel legitimately. Other countries that have looked at this and how to do this and what kind of mechanisms have found this challenging and have raised different practical issues. But we are continuing to look with our international allies at what measures could be strengthened in order to address exactly these issues and to promote the cause of peace and security.
Lincoln Jock.
Thank you, Madam Deputy Speaker. Thank the Foreign Secretary for her statement on the multinational maritime mission. What exactly are the Brits going to contribute to it in terms of hardware? And secondly, has Ukraine offered up its 2 Sandown-class mine-clearing vessels and crew, which are currently in Portsmouth?
So the multinational maritime mission is led by the UK and France. We have set out and been looking at particular assets that can be provided as part of the mission. It is, of course, multilateral. That is the point, that it needs to include a range of different countries as part of it. We have also had discussions with Ukraine, but also many Gulf countries have had conversations with Ukraine because of their expertise now, particularly around drones, particularly around modern technology in terms of air defences as well, that have provided support for some of the Gulf partners as well as part of this. The precise assets that in practice are used will depend on what is needed at the point at which we hope settlement will be reached. One of the points as part of the settlement that's been discussed is whether Iran itself will do the demining, which would clearly be most effective because they laid the mines in the first place. So we would like them to do it if that is possible first.
Deputy Speaker, and I thank the Foreign Secretary for her statement today, particularly the fresh wave of sanctions that she's announced, but also the new measures against British businesses and charities that fund and support illegal Israeli settlements in occupied Palestine. But this morning, I and other MPs met with former members of the Israel Defence Force who'd served in Gaza, and they gave us some pretty shocking testimony. They told us that their rules of engagement were to allow the killing of more than 20 civilians for every Hamas commander that was targeted, sometimes up to 300 civilians per commander. And they also said that they were given shoot-to-kill orders for any male of adult military age within a designated area, including unarmed men. And they also said there was a systematic demolition of civilian homes. So what is the Foreign Secretary going to do to say that the UK, what role the UK can play in amassing the evidence to hold Israel to account for what are clearly war crimes in occupied Palestine?
The account that my honourable friend provides is deeply disturbing. We know that there has been a systematic disregard for civilian life. We've seen the huge numbers of people killed in Gaza, including the huge numbers of children who have been killed. And also we saw at different stages in this conflict, we saw people shot at while queuing for food in the most basic of ways, when desperate people who are desperate to feed their families ended up being shot at and losing their lives as well. There has to be accountability, there have to be investigations, there also has to be peace, and there has to be stability, and we also have to ensure that as part of the implementation of the 20-point plan, we get back on track so that Palestine can be run by Palestinians, because that, in the end, is the best way to keep them safe.
Thank you, Madam Deputy Speaker. The Secretary of State, in her own statement, in her own words, talks of Netanyahu's condemnation of settler violence as hollow. So may I ask the Secretary of State if she will or if she will not allow the great Israeli real estate event proceeding in UK soil this weekend? And if indeed she does, could she not be accused of the same thing?
I can tell him we are pursuing that issue. We do not want there to be any illegal settlements advertised in the UK. We do not want any businesses to be engaging with that.
Thank you, Madam Deputy Speaker, and can I welcome the sanctions and guidance that the Secretary of State has set out. I would just say, given the scale and pace of settlements, can we make sure that those sanctions are regularly reviewed? And I will also agree with other colleagues that a ban on settlement trade should be looked at again. Regarding the London Property Conference, this does sound really concerning. And can we say what sanctions will be put in place if property is being sold on occupied land?
So I can tell my honourable friend we will continue to keep all of our sanctions under review, and we will continue to build on the sanctions regimes that we have in place. We have led the world on this, and we have done more on sanctions than most other countries across the world. Wherever possible, we have built partnerships to involve other countries and to include other countries and get them to sign up to similar sanctions as well, because frankly that is the best way to have an impact.
Caroline Verdon.
Speaker, a constituent wrote to me deeply concerned that the British public had been misled about the UK's involvement in the US conflict with Iran. His sister lives next to RAF Fairford and reported 24/7 use of the base by US bomber flights in May after the ceasefire. Residents were experiencing constant aircraft movements and noise with little or no respite. Constant use of the base does not appear to be consistent with facilitating specific and limited defensive action against missile facilities. So can the Foreign Secretary reassure both the House and my constituent that RAF Fairford was used exclusively for defensive strikes against Iran, that no planes or drones have conducted no RAF planes or drones have conducted reconnaissance over Palestine or Lebanon and shared that intelligence with Israel, and that the truth here is not being concealed from the British public?
Well, the honourable member will know that RAF Fairford and Fairford is a US base. And we were clear at the beginning of this conflict that we would not support the use of the base for offensive action against Iran and for offensive action as part of this conflict. Once the Iran started to strike Gulf partners, including their civilian infrastructure, including their airports, including other assets, and put lives at risk, including the lives of British citizens at risk, we did provide support for the air defences directly. UK assets provided that support, and we also enabled basing support for US operations as well. And I think that was the right thing to do in order to be able to defend our partners who were facing Iranian strikes. There is a difference between the offensive and the defensive approach, and that is the approach we have taken.
Lorraine Beavers.
Thank you, Madam Deputy Speaker. In Gaza, the West Bank and Lebanon, Israel continues to violate international law with total impunity. I welcome the Secretary of State's action today against individuals and networks enabling settler violence, but this just doesn't go far enough. Why won't the Secretary of State at least commit to banning all trade with illegal Israeli settlements and introduce a comprehensive sanctions regime against the Israeli state?
Well, what I would say is we strongly distinguish between the illegal settlements and the Israeli state. We would distinguish between the illegal settlements and businesses in all parts of Israel that have long traded across the world, including traded with the UK, and many of whose business owners or business investors may also strongly disagree with things that the Israeli government are doing, or may strongly disagree with illegal settlements and with settler violence as well. So I think it is important to separate out the issues around Israeli businesses more widely and the specific issues of the settlements and the illegal settlements. We do not want to see trade with illegal settlements. We do not want to see UK businesses operating within those settlements, either in financial or economic activity within those settlements. We certainly don't want to see them supporting construction contracts for the E1 settlements. And that's also why we have introduced these sanctions, this new wave of sanctions, to target those organisations that have been most strongly linked to facilitating, including funding as well, to those organisations most linked to settler violence.
Henley.
Secretary that the humanitarian situation in Gaza is grave and that renewed international energy and focus is required if the level of humanitarian aid flowing into Gaza is to be increased with the urgency it demands. And with that in mind, can I ask whether she'll ensure that the increased international cooperation and immediate action to ameliorate the situation will be a key priority of these discussions held in Paris later this week?
Yes, I can tell her that that will be a priority for discussions in Paris. The other thing that the Paris event is seeking to do is also to bring together Palestinian and Israeli civil society groups. So as well as trying to reinvigorate some of the international coalition and energy behind the peace process for not just Gaza but also for the West Bank, it is also seeking to bring together civil society groups from Palestine and Israel to stand together for peace.
John Grady.
And I welcome my right honourable friend, the Foreign Secretary's statement. But I must say, on the ban on trade with illegal settlements, whilst I appreciate it may be complicated, our moral duty is to overcome those complications. The conflict creates very serious issues for some of the poorest countries in the world who cannot withstand the energy and food crisis shocks. And this creates a risk of further conflict and instability, for example, in sub-Saharan Africa. Can I ask my right honourable friend what steps she is taking with international allies to address these risks, and also perhaps to give us an update on the situation in Sudan, where further atrocities are taking place?
I agree with my honourable friend that the closure of the Strait of Hormuz is having an impact on oil across the world. It's also having an impact on fertiliser across the world, including for sub-Saharan Africa as well. And there are some states, affected by the level of their dependency on different supply chains, who are particularly heavily affected by this impact on the global economy. We are closely monitoring which of those countries are affected, and we are also directly raising this with the World Bank, with other organisations, and making sure that our ODA and our aid support is also reflecting some of those issues as well. And on Sudan, we are continuing to work closely with the international community on Sudan, and we'll be having further such meetings shortly, because this continues to be the most horrendous humanitarian crisis, and we need that international energy around Sudan as well.
David Chadwick.
Thank you, Madam Deputy Speaker. The Foreign Secretary will know that the ongoing violence continues to take a horrific toll on civilian populations across Lebanon, Gaza and the wider region. And given our legal obligations under the Strategic Export Licensing criteria, what assessment has the government made regarding the risk of UK-supplied components being used in violations of international humanitarian law? Will the government publish those assessments so that they can be properly scrutinised? And will the government now take the decisive step to halt all arms exports to Israel?
I can assure him that we do ongoing assessments. We take immensely seriously our obligations around the strategic export licences under humanitarian law, international law, and ensure that assessments continue to be done. It is one of the reasons why we suspended arms exports in a series of areas to Israel soon after this government came to office, exactly because we took that so seriously, and also I think, as I understand it, published legal advice at that time as well.
Joe Morris.
Speaker, and can I add my voice to those people across the House in urging for stronger actions on Israeli war crimes. But can I just quickly touch on fertiliser, which is a key issue, not just across the world, but also in my constituency. I've been speaking to a lot of local farmers who are deeply concerned that they will feel the pinch already, but that will shortly be passed on to consumers within the UK and drive up the already spiking cost of living. So can she just outline some of the steps she's taking to make sure that more fertiliser is available in our part of the world and indeed across the world to combat global hunger?
My honourable friend is exactly right, and right to champion the farmers in his constituency, because this Strait of Hormuz closure risks impacting the cost of living right across the globe as a result. It's why we have made the reopening of the strait the central part of what needs to be achieved as part of a peace settlement. It has to be full, unconditional, not just a partial reopening of the strait, because it's so important to get the fertiliser, the oil, the different commodities flowing again. But it is also why I think we need to look further at our economic security and supply chains more widely, because we should be seeking internationally to avoid choke points where any country can hold the global economy to ransom in the way that Iran has done.
Iqbal Mohammed.
Thank you, Madam Deputy Speaker. I'm sorry to say that the sanctions and actions announced today will not prevent Israel from continuing to act with impunity and commit war crime after war crime. On Friday, I received a reply from the Foreign Office to a letter I sent 3 months ago on the UN Commission of Inquiry findings that Israel has committed genocide in Gaza. In that reply, the Minister for the Middle East stated, and I quote, "As soon as this government took office, we ordered a review into Israel's compliance with international humanitarian law, which has continued to conclude that Israel is not committed to upholding IHL in Gaza." So why, in light of that assessment, is this government still limited to giving statements of concern rather than taking meaningful actions to prevent further atrocities and breaches of IHL?
Well, I would just say to him, it's exactly because of that review that was commissioned immediately after we came into government that we suspended a whole series of arms export licences. We took practical steps, just as we have also done in providing additional aid and additional support, just as we have also done in introducing whole swathes of sanctions. This is our 4th round of sanctions in this area, and why we will continue to do that as well. But I have to say to him that in order to get overall impact, we need an international coalition. No one country can do this alone. The impact that was felt in the autumn to get the 20-point plan for Gaza took countries from around the world coming together. That is what we need again, and that is why we need to drive this through international diplomacy and activity, as well as through the actions that we here in the UK take.
Thank you, Madam Deputy Speaker. Regarding helping the Palestinian Authority, does my right honourable friend agree that what we need is the opposite of the approach that she's rightly outlined regarding British companies, individuals and organisations and charities regarding the illegal West Bank settlements? And by that, I mean that we need companies and individuals and others to be encouraged and indeed empowered to help the Palestinian Authority with rebuilding, economic development, governance and more. And as she said, this would reinforce the unity of the West Bank, Gaza and East Jerusalem as inseparable pillars of the State of Palestine, and that would be in support of the global alliance to implement the two-state solution, which I hope she can reiterate that we support.
Oh, can I welcome my honourable friend's points, because in order to have a state of Palestine, we need to support the Palestinian Authority to become a functioning and effective state. That includes funding, but it also includes pressure, because currently the Israeli government is withholding Palestinian money, and that money needs to be restored to them, and we need to be able to support the Palestinian economy as well.
Moran. Thank you, Madam Deputy Speaker. I welcome the update on the new and coordinated sanctions announced by the Foreign Secretary today. Madam Deputy Speaker, according to the United Nations, their own figures show that violent incidents perpetrated by illegal Israeli settlers in the West Bank reached an all-time high last autumn, for the shameful reason that these attacks reach their peak when there are fresh olive harvests to destroy. This behaviour is state-sanctioned, settlements are state-sponsored and state-financed. The government accepts that the settlements are illegal. So why then has the government chosen not to end trade with illegal Israeli settlements once and for all?
Well, it is exactly because of our deep concern about the illegal settlements and also about the settler violence and the escalating scale of settler violence that we have introduced these new sanctions, which go after many of the organisations that have the greatest impact in terms of funding and in terms of organisational support for the settlers, where we have seen these very serious problems. We've also strengthened the issues around business, because no businesses from the UK should be trading or engaging in economic activity in these illegal settlements, and we will continue to work with international allies on what more can be done, both around illegal settlements but also around the wider peace process. And I do say again, we will only make progress on this wider peace process in conjunction with our allies and partners too.
And that concludes the statement. I'll give the front benches a few minutes to swap over. We now come to the presentation of bills. Presentation of Bill Secretary Shabana Mahmood.
National Security State Threats Bill.
Second reading what day?
Tomorrow.
Tomorrow. The clerk will now proceed to read the orders of the day.
Steel Industry Nationalisation Bill, Committee.
Now.
Order. Under the order of the House of 21st of May, we shall now move to the Committee of the Whole House. Order.
Steel Industry Nationalisation Bill.
I remind members that in committee, members should not address the Chair as Deputy Speaker. Please use our names when addressing the Chair. Madam Chair, Chair and Madam Chairman are also acceptable. We will begin with Amendment 7 to Clause 52, with which it will be convenient to consider the amendments. Clauses stand part and new clauses as on the selection paper. I call Sarah Olney to move Amendment 7.
Thank you, Madam Chair. I beg to move. We heard throughout yesterday's debate, and no doubt again today from members across the House, the importance of steelmaking as a vital strategic sector in the UK. We rely on the sector for essential parts of our national infrastructure, for transport, for advanced manufacturing. Steelmaking and the industry more broadly creates thousands of good jobs across the country, helping to power our economy and boost our local communities. And in increasingly uncertain times, it is essential to support our defence industry. So we on the Liberal Democrat benches broadly welcome this legislation as a temporary, emergency and targeted step aimed specifically at turning around British steel before it can be returned to the private sector, and we note that it is in this spirit that British steel producers also support these measures. And we need to see more ambition and clarity in the delivery of the steel strategy, for example, when it comes to boosting domestic production to meet 50% of domestic steel demand, further incentivising the use of British-made steel in the private sector and managing the transition to electric arc furnaces. So I wish to speak in favour of Amendments 7, 8 and 9. These would strengthen the treatment of environmental liabilities in relation to the steel undertaking and ensure that they are explicitly identified and accounted for before compensation payments are made. They highlight the principle that the true financial position of an undertaking cannot be properly understood without a clear and transparent assessment of its environmental liabilities. In accepting these amendments, this legislation could work as a package to ensure that environmental liabilities are not only considered, but formally assessed, published and laid before Parliament. In particular, they would require an independent valuer to prepare a written estimate of the environmental liabilities associated with the undertaking, including contamination of land, water or air, compliance with environmental obligations, and both current and future remediation or restoration costs. This would ensure that the full environmental cost of the undertaking's operation is properly captured, including liabilities that may not yet have crystallised.